Philippines natin tapos yung Philippines videos pa. So, mga 40 minutes, more than 30 minutes siya. Tapos papalabas pa yung
For over 50 years, BPL Medical Technologies has been providing quality solutions in healthcare. We are made in India for India and the world. Our ISO certified production units and our widespread network of sales and service partners helps in maintaining smooth operations for all customers. We are committed to delivering excellence and driving innovation. BPL Medical Technologies offers a wide range of medical solutions: cardiology, critical care and surgery, imaging, women and child health, home care, consumables and accessories. BPL Medical Technologies offers end-to-end solutions for hospitals and medical facilities, including ambulatory and emergency, operating rooms, ICU and NICU, radiology, general wards, OPD, and pharmacy. We've been fortunate to work with some of the biggest names in the healthcare industry and are thankful for their kind words. We are always close to you, providing end-to-end solutions that meet all your needs at the right time. We look forward to being your medical solutions provider and building a long and fruitful partnership.
Healthcare is a basic human right. Yet sadly, this remains out of reach to most Filipinos, especially those in greatest need. The COVID-19 pandemic magnified and amplified the problems of Philippine healthcare. But imagine a world where quality healthcare is affordable and accessible to all. This is the vision of AC Health. AC Health is developing an integrated ecosystem composed of service touchpoints across the health continuum. Integrated through and powered by human resource development, supply chain management, and technology innovation. Healthway operates as a comprehensive network of primary, multi-specialty, and corporate clinics that serve patients where they live and work. Generica supplies affordable medicines to over 800 communities nationwide. IE Medica and MedEthics ensure cost-efficient distribution of a wide pharma cabinet. Health Now is the country's first unified digital health portfolio, enabling a growing number of online engagements, including physician consultations and medicine deliveries. We are also building the Philippines' first dedicated cancer specialty hospital focused on providing affordable, high-quality cancer care to more Filipinos. QualiMed completes the AC Health ecosystem, enlarging our clinic footprint and providing a tertiary care hospital base, all to deliver truly integrated, seamless, quality, and affordable patient care for Filipinos. The health crisis confirmed our ecosystem paradigm. Shared vision, mission, and values ground us. Innovation, synergy, and scale position us for growth and leadership. Truly, the whole will be greater than the sum of the pieces. Together, in partnership, we will realize our collective vision for health and deliver on our promise to improve healthcare for all.
Made in India and marketed across the world. That's the mantra of global automotive giants today. The forging industry has played an equally vital role in boosting India's engineering capability. India has become a single-source total solutions provider in every aspect of forging, taking the lead in industrial castings too. India is now one of the top 5 in terms of global production. Reacting quickly to the needs of international engineering standards, Indian machine tool manufacturers upgraded their traditional manufacturing base to offer the latest. And all this is based on the strength of the Indian steel industry. Recognized as one of the very few in the world that's slated for major growth, India is now a significant exporter of prime steel. India's industrial performance has also been powered by a flourishing electrical industry in generation, transmission, and utilities. That's what has qualified India to become a project partner of choice globally. India is where the action is, because India is engineering the future, where you get the best of an established, mature industrial base and all the benefits of a robust, resourceful, fast-growing family of small and medium-scale enterprises. Send your shopping list to EEPC and see how your profits are made in India.
India, a country with 1.3 billion people, 4,000 cities and towns, over 6 lakh villages, have most doctors living in the cities. This leaves a huge population living in smaller towns and villages without access to quality healthcare. With the country within the grip of a pandemic, doctors and paramedics, even while working round the clock, could not meet the needs of the huge populace affected by the outbreak. Healthcare had to be taken to each and every home. But how? The answer was to transform access, experience, and outcome through technology. Harnessing the powerful combination of technology and human ingenuity, we provided innovative care that was patient-centric. People needed access to care that was convenient, equitable, and affordable when, where, and how they demanded it. Whether it's one-to-one, virtually, or at home. To support this, our Apollo 24/7 app with Doctor on Call, Medicine on Call, testing at home, all at a tap of a button became an instant hit. The step towards humanizing technology helped the clinicians to organize and coordinate virtual consultations and remote monitoring of patients involving the family members and caregivers. We launched Coverage, the blueprint to fight COVID, an integrated multidisciplinary COVID care management program that was rolled out to drive awareness, assistance, and screening, along with robust treatment protocols, all by leveraging technology to provide safer person-centric experiences. Our AI-enabled COVID risk assessment tool helped over 1.4 million people across 51 countries. In anticipation of an increased need of medically supervised isolated care, Apollo launched Project Stay I, an innovative initiative to strengthen the bulwark against COVID-19 by creating isolation rooms in partnership with hotels to provide medical supervision for quarantine, freeing up the hospital beds for more critical patients. Every experience was personalized and differentiated with the launch of AI-driven health management program called Apollo Pro Health, built on the cornerstone to predict, prevent, and overcome the non-communicable diseases for helping individuals take charge of their health. Better outcomes were delivered using advanced diagnostics and precision care technologies like robotics and minimal invasive procedure, ensuring shorter hospital stays and superior outcomes. This further eased out resources so that we could care for more patients. Humanizing technology for the clinical staff was interesting in its own way. Our clinical dashboard helped clinicians work smarter and communicate better. Picture archiving and communication system helped our doctors to conduct a more accurate diagnosis with chronological view of their patient's medical history. Apollo e-Access, the modern and sophisticated critical care monitoring system for anytime, anywhere care, helped us reach out to the remotest places, providing quality critical care services round the clock. Similarly, teleradiology helped faster diagnostics, provided improved and affordable consultation for patients in rural areas, with expert physicians and radiologists sitting miles away. Humanizing technology means bringing the human connection back into the core of healthcare in the midst of the pandemic. We at Apollo Hospitals ensure that millions of lives are improved across the country so that the land of festivals, culture, and heritage continue to remain a healthy place.
What makes a future special? Perhaps it's in what you see. And how we see it. What you hear. And how we listen. And if you seek a future that's worth depending on, we've got you covered in every way. We even added a little cup of comfort. And tasteful little details to show how much you mean to us. We are moving forward, innovating our touch of care. Making us available at any hour, at any day. So we can be more responsive. So we can be more connected. This is how we make the future of healthcare special. By making you experience you are special in every sense. We go beyond care. Experience MaxiCare Primary Care Centers today. MaxiCare Primary Care Center, a relaxing healthcare experience. Visit MaxiCare Primary Care Centers at these locations. Or visit our website at www.maxicare.com.ph to check the branch nearest you. MaxiCare, live your best life.
Cathy Plus Safety IV Cannula ensures the safety of healthcare professionals by reducing the chances of their catching infections caused by used IV cannulas. It has a protection device, SIP clip, which automatically covers the bevel after the withdrawal of the needle from the wing to prevent contaminated needle stick injury. Its siliconized, sharp, beveled, back-cut stainless steel needle ensures optimum insertion, along with smooth venipuncture with minimal pain. It has a Volex catheter with longer indwelling period that results in lower insertion force, cleaner reinsertions, and softens in vivo, leading to less frequent changing of IV cannula. How to give additional medication to the patient? The injection port cap facilitates additional medication and also prevents its backflow without taking help of another needle-based injection. How to cannulate veins which are difficult to find? It has a specially designed needle that allows rapid blood flashback visualization for small diameter 24G and 26G to aid successful cannulation in first attempt and avoid attempts of reinsertion for the veins which are difficult to find. Cathy Plus Safety IV Cannula prevents reuse, prevents injury, requires no change of procedure, and need to retrain, and also has automatic involuntary activation of SIP clip. Choose Cathy Plus Safety IV Cannula with SIP clip and remain safe from possible infections due to accidental injuries caused by contaminated needles.
This is Mike. He has diabetes and his last eye exam was a year ago. His vision is also blurred and he isn't sure if the problem is a change in power or something more serious. A visit to the ophthalmologist would take at least half a day and his eyes would need to be dilated. What if a checkup could be done at a nearby pharmacy or supermarket within 2 minutes? Or what if he could get his eyes tested right at home? Remedio is inventing this future with patented AI-enabled devices. These devices can screen your eyes for cataract, refractive error, glaucoma, and retinopathy. Whether it's in your living room or in an automated kiosk nearby, our devices can be used to screen your eyes without a specialist being present on site. Join us on this journey to make eye care accessible, convenient, and affordable. This is Mike. He has diabetes and his last eye exam was a year ago. His vision is also blurred and he isn't sure if the problem is a change in power or something more serious. A visit to the ophthalmologist would take at least half a day and his eyes would need to be dilated. What if a checkup could be done at a nearby pharmacy or supermarket within 2 minutes? Or what if he could get his eyes tested right at home? Remedio is inventing this future with patented AI enabled devices. These devices can screen your eyes for cataract, refractive error, glaucoma, and retinopathy. Whether it's in your living room or in an automated kiosk nearby, our devices can be used to screen your eyes without a specialist being present on site. Join us on this journey to make eye care accessible, convenient, and affordable.
Good afternoon, dear delegates, and welcome to the Embassy of India, Manila Business World's India-Philippines Business Conference on Healthcare and Medical Cooperation. The program will start promptly at 1:30 p.m. Philippine time and 11 a.m. India time.
This is Mike. He has diabetes and his last eye exam was a year ago. His vision is also blurred and he isn't sure if the problem is a change in power or something more serious. A visit to the ophthalmologist would take at least half a day and his eyes would need to be dilated. What if a checkup could be done at a nearby pharmacy or supermarket within 2 minutes? Or what if he could get his eyes tested right at home? Remedio is inventing this future with patented AI-enabled devices. These devices can screen your eyes for cataract, refractive error, glaucoma, and retinopathy. Whether it's in your living room or in an automated kiosk nearby, our devices can be used to screen your eyes without a specialist being present on site. Join us on this journey to make eye care accessible, convenient, and affordable.
years, BPL Medical Technologies has been providing quality solutions in healthcare. We are made in India for India and the world. Our ISO certified production units and our widespread network of sales and service partners helps in maintaining smooth operations for all customers. We are committed to delivering excellence and driving innovation. BPL Medical Technologies offers a wide range of medical solutions: cardiology, critical care and surgery, imaging, women and child health, home care, consumables and accessories. BPL Medical Technologies offers end-to-end solutions for hospitals and medical facilities, including ambulatory and emergency, operating rooms, ICU and NICU, radiology, general wards, OPD, and pharmacy. We've been fortunate to work with some of the biggest names in the healthcare industry and are thankful for their kind words. We are always close to you, providing end-to-end solutions that meet all your needs at the right time. We look forward to being your medical solutions provider and building a long and fruitful partnership.
Healthcare is a basic human right. Yet sadly, this remains out of reach to most Filipinos, especially those in greatest need. The COVID-19 pandemic magnified and amplified the problems of Philippine healthcare. But imagine a world where quality healthcare is affordable and accessible to all. This is the vision of AC Health. AC Health is developing an integrated ecosystem composed of service touchpoints across the health continuum. Integrated through and powered by human resource development, supply chain management, and technology innovation. Healthway operates as a comprehensive network of primary, multi-specialty, and corporate clinics that serve patients where they live and work. Generica supplies affordable medicines to over 800 communities nationwide. IE Medica and MedEthics ensure cost-efficient distribution of a wide pharma cabinet. Health Now is the country's first unified digital health portfolio, enabling a growing number of online engagements, including physician consultations and medicine deliveries. We are also building the Philippines' first dedicated cancer specialty hospital focused on providing affordable, high-quality cancer care to more Filipinos. QualiMed completes the AC Health ecosystem, enlarging our clinic footprint and providing a tertiary care hospital base, all to deliver truly integrated, seamless, quality, and affordable patient care for Filipinos. The health crisis confirmed our ecosystem paradigm. Shared vision, mission, and values ground us. Innovation, synergy, and scale position us for growth and leadership. Truly, the whole will be greater than the sum of the pieces. Together, in partnership, we will realize our collective vision for health and deliver on our promise to improve healthcare for all.
Good afternoon. The program will start in 5 minutes. The program will start in 5 minutes. Good afternoon, everyone. The program is about to begin. Please take your seats. Good day, everyone, and thank you for joining us here at the Shangri-La, the Fort Manila, in person or online. Please welcome our host, Mr. Chester De Los Santos.
All right, good afternoon, everyone. Welcome to the Embassy of India, Manila Business Roads, India, Philippines Business Conference on Healthcare and Medical Cooperation being held today via hybrid mode. Now, thank you very much for joining us physically here at the Shangri-La The Fort in Manila and virtually via our Business World Insights live stream on our Facebook pages of Business World and the Philippine Star. Again, let me introduce myself. I am Jess De Los Santos, a news anchor for One News, and I will be your host and moderator for today's event. Now, in the past 2 years, the COVID-19 pandemic taught the crucial significance of collaboration and cooperation within and between the public and private sectors, as well as among organizations as they dealt with the widespread impact of the global health crisis. Now, such cooperation is also valuable and opportune among global regions and neighboring nations, especially in further enhancing healthcare. Now, the Philippines and India, for instance, have big opportunity to actually cooperate towards improving healthcare, especially as healthcare has become one of India's largest sectors. Now, the Indian healthcare market is expected to reach 372 billion US dollars by 2022. That's at a compound annual growth rate of 39%. The digital healthcare market in India was valued at $1.5 billion in 2018, and that's estimated to be valued or reach $6.3 billion by 2024, expanding at a CAGR of 27.4%. Now, that's at least during the 2019 to 2024 period. That with such growth, coupled with India's expertise in technology, Philippines-India relations can further be optimized towards making healthcare and medical services more available and accessible in this country in time when the universal healthcare starts being implemented. In this business conference, government and industry leaders from both India and the Philippines will highlight the opportunities, strengths, and potential for collaboration in the fields of healthcare services, pharmaceuticals, and medical devices. The India-Philippines Business Conference on Healthcare and Medical Cooperation is presented by the Embassy of India, Manila, and Business World Publishing Corporation with partner organizations, Federation of Indian Chambers of Commerce and Industry, India Business Forum, EEPC India, Federation of Indian Chambers of Commerce Incorporated, and the Management Association of the Philippines, and of course our media partner, the Philippine Star. Now, to formally start the program, may we call on stage our distinguished guest joining us here at the Shangri-La The Fort. Let's give a round of applause for our guest, His Excellency Ambassador Shambhu S. Kumaran, Wilfredo G. Reyes, and Ms. Alma Rita Jimenez. Again, let's give them a round of applause as they make their way here to the stage. All right, again, let's give a round of applause to our distinguished guests. Now, this time, to welcome us to this important forum, please welcome the Editor-in-Chief of Business World, Mr. Wilfredo G. Reyes.
Thank you, Jester. His Excellency Ramon Bagatsing Jr., Philippine Ambassador to India. His Excellency Shambhu Kumaran, India's Ambassador to the Philippines. I'd also like to greet senior government and industry officials from India who are with us here physically or virtually. Mr. C. Rajasekhar of the Ministry of External Affairs. Mr. Jayesh Ranjan, Principal Secretary of the Industries and Commerce, as well as Information Technology Departments of the Government of Telengana. Mr. Arun Garodia, Senior Vice Chairman of India's Engineering Export Promotion Council. And Mr. Karthik Rajagopal, co-chair of the Federation of India Chambers of Commerce and Industries Health Services Committee. I'd also like to note the presence of Ms. Alma Jimenez, chairperson of the Management Association of the Philippines Health Committee. Distinguished guests, panelists, both here on site and those viewing these proceedings virtually, good afternoon. Allow me to welcome you to the India-Philippines Business Conference on Healthcare and Medical Cooperation. This forum comes at a time when we appear to be at a crossroads as far as the pandemic is concerned. Hopefully, we are seeing the beginning of the end of this scourge, even as cases are again on the rise in parts of Asia and in Europe. These days also, all eyes here in the Philippines have been increasingly on the upcoming general elections and the policies that will be adopted by the next administration. If there is any silver lining at all in the past more than 2 years, it is that this crisis has exposed systemic weaknesses that need to be plugged if we are to be more resilient, including and especially in the field of healthcare. For in the same way that past financial crises led to steps to make banks more resilient, the current emergency will hopefully lead to a stronger Philippine health system that will help us provide universal health care and prepare us better for the next pandemic. And clearly, this is where closer cooperation with India will come in handy. India has long been a regional power. It is one of the largest economies in the world, the third biggest in Asia. Traits that are made even more significant for us here in Southeast Asia by that giant's look east and act east policies that have been in place since 1992. Its pharmaceutical industry is among the biggest in the world, and Indian companies lead particularly in generics and affordable vaccines. Hence, pharmaceuticals have been the second biggest item the Philippines has imported from India since at least 2016. There is clearly much more that we can gain from closer healthcare links with India, now that the pandemic has opened our eyes to potentials of various technologies to improve healthcare delivery, as well as local production of active pharmaceutical ingredients, vaccines, and essential medicines. It is in this light that we welcome opportunities like today. While this conference is not the first to explore avenues for closer cooperation with India in health matters, we hope that this afternoon's sessions will contribute to more collaboration in this field and identify what is needed to make sure these efforts succeed. As Business World chronicles events in these historic times and serves as a forum where ideas are exchanged, we will certainly follow with great interest initiatives that will spring from this conference. Hence, we look forward to fruitful discussions among us. Thank you.
All right, again, thank you very much, Mr. Wilfredo Reyes from Business World. Now, to give his introductory address, I'm honored to introduce to you Mr. Karthik Rajagopal, co-chair of the Federation of Indian Chambers of Commerce and Industries Health Services Committee and Chief Operating Officer of the Manipal Health Enterprises Private Limited.
Thank you very much, and good morning, all the dignitaries, and good morning, all the delegates as well. It's my real pleasure in being here for two reasons. Two great countries are trying to explore partnership opportunities. And second, while one look at me and the way I speak will actually say that I'm wholly Indian, I have a little bit of a Filipino in me, having graduated from the Asian Institute of Management. And, must say Makati was one of the best cities that I've ever actually lived in. The last 36 odd months have actually completely changed the trajectory across the world and specifically around the area of health. And that's where I think collaboration, the word collaboration, has never actually had a more enriched meaning as it is having today. The Indian healthcare space obviously has kind of evolved And specifically over the last 30 months, in terms of some of the significant initiatives that have actually happened with the government and the private sector actually coming in together. The national health policy has been one of those big successes, and the Make in India, the Digital India Mission, etc., are some of the other initiatives that the Indian healthcare ecosystem is actually taking in. Some of the other large, fairly, large goals that the Indian healthcare system is actually looking at is obviously the universal health cover that we're looking at for all citizens, plus probably primary care across all age groups. But if I were to actually go ahead and point out one area in which the maximum leap has happened, that's actually in the digitization in the healthcare space. And that's where I think countries like India and many others have actually moved from a sleep mode to a sprint mode in very, very quick time. And the Indian health tech space is actually growing leaps and bounds. And if you really look at much of the interest that have happened in, from a foreign investor point of view, and even from some of the local domestic institutional investors, it's probably in the health tech space, be it artificial intelligence, Internet of Medical Things, analysis, genomics for analysis, etc. Tremendous interest. And this is probably where I think if India and Philippines can look at areas for collaboration, it would actually be tremendous. A lot of similarities between the two countries in terms of the geography spread of healthcare and the concentration in specific large cities, because I think both Philippines and India don't have a healthcare system that's spread equitably across the super specialty space, across the wide cross sections of the country. And that's where telemedicine and, video health can actually make a tremendous difference, because sometimes in healthcare, it's all about the right detection and the right diagnosis at the right time. And as we actually start to go ahead and progress, telemedicine, teleconsultation, which will evolve much to the confidence of both the patients as well as the clinicians who are actually seeing them. India has made tremendous strides in this space. And, from a time when telemedicine was still a law that had not yet been approved, to the way today that where thousands of consultations are happening, across the country, the video consultations per day. I think it's been tremendous scope for a lot of collaboration. I think some of these best practices can actually be exchanged between the countries. The other similarities that we actually see is the increase in the non-communicable diseases, and that's another area where scope for partnership is there in areas such as oncology, areas such as cardiology. Nursing exchange programs between the two countries can help greatly improve quality and understanding what's actually happening between the two countries. Clinical research is another area where which offers a lot of potential. The other area would be medical value travel. India actually ranks number 10 on the medical value travel index, and today also, if you really look at it, some parts of the Filipino population actually move out of their countries for core super specialty care, maybe multi-organ transplants or other areas in which probably they do feel that healthcare is better represented outside of the Philippines. And that's probably where India can be of great help, because this is one country which we can very, very confidently say we offer first world quality at third world prices. And that can be significant saving of foreign exchange for Philippines as they actually look to go ahead and react. Now, the tremendous English-speaking capability of the Filipino population, I think, is a huge, huge advantage. And, in terms of collaboration, makes that much easier, because when we actually deal with some of the other nations, obviously language definitely becomes a barrier. But in Philippines' case, that is something that we believe, holds a very natural advantage. And medtech, medical equipment space, is where India is again, given the emphasis on the Make in India stuff. Actually, after the pandemic, that's where Indian medical equipment industry has been making, giant leaps, and they've started to go ahead and collaborate with many Southeast Asian nations. And Philippines could be one where, this would probably augur well as partnerships with the two countries as well. So this is broadly the context setting for today's conference, and I'm sure there would be other areas that would actually get discussed, get debated, etc. But I think that would, this was a setting of the context, what could possibly be areas of association. FICCI has been playing a very, very important role in the Indian healthcare scenario, be it through various stakeholder forums, providing thought leaderships, working around the regulatory and policy recommendations for the government. Their role, during the pandemic has been greatly appreciated by everybody, be it, logistics and supply assistance at the time, working with the government very, very closely for the national vaccine rollout, etc. And I'm sure FICCI will continue its, great emphasis in the Indian healthcare system. So these were what I actually wanted to go ahead and, talk about. Good luck to all the speakers as you actually start to go ahead and deliberate and come up with some concrete and conclusive next steps. To reiterate, tremendous opportunity for collaboration and partnership between these two countries. Thank you all for listening in, and good morning.
Mr. Karthik, for that insightful introductory address. This time, also to give his message, please welcome Mr. Arun Kumar Garodia, Senior Vice Chairman of the Engineering Export Promotion Council, or EEPC India.
Thank you, Mr. Santos, for giving me this opportunity. His Excellency Shambhu S. Kumaran, Ambassador of India to Philippines. His Excellency Ramon S. Bagatsing Jr., Ambassador of Philippines to India. Mr. Wilfredo Reyes, Editor-in-Chief, Business World. Dr. Ashutosh Raghuvanshi, Chair, FICCI Medical Value Travel Committee and Managing Director and CEO of Fortis Healthcare. Eminent speakers on the medical device sector from India and Philippines, industry members, ladies and gentlemen. Good morning to my friends from India, and a very good afternoon to the audience from Philippines. First of all, let me convey my sincere thanks to the Embassy of India in Philippines for inviting me to this very important session on India-Philippines Business Conference on the healthcare and medical cooperation. India and Philippines share a rich heritage of cultural diversity and contribution to the international trade. Both the countries share many similar healthcare priorities like elimination of communicable diseases and working towards the objective of making available quality and affordable health facilities to the population in both the countries. India's imports of medical device sector from Philippines have consistently grown over the years and stood at $10.32 million in April to January 2021 until 22, whereas exports from India for the medical device to Philippines were to the tune of $12.38 million during the same period. Over the years, India has built strong foundations supported by strong manufacturing ecosystems, due to which Indian medical device sector was declared as a sunrise sector in the year 2014, along with the launch of Make in India campaign. There have been several new initiatives in the recent years, including the introduction of PLI scheme for the medical sector and the release of the National Medical Device Policy 2022, with an aim to boost the domestic production of the medical device sector. The draft policy envisages that by the year 2047, India will be among one of the top 5 global manufacturing hubs in terms of value and technology for the medical device sector. EEPC India is the nodal body under Ministry of Commerce and Industry, Government of India, and is working towards the promotion of trade and investment in the medical device sector. There have been several initiatives undertaken by the Council, like launch of a Brand India engineering campaign for the medical device sector, launch of an e-catalog for the sector, and also promoting manufacturing. technology, and innovations in the sector to meet the global quality standards. The Indian medical device sector industry, currently valued at 11 billion US dollars, is expected to grow and to a tune of $50 billion by the year 2025. The Indian medical device and surgical equipment industry is fragmented with close to 1,800 domestic units. Primarily of them, they are MSMEs. India's healthcare sector is getting introduced with many new and destructive technologies like robotics, artificial intelligence, Internet of Things, and 3D printing, etc. India is working towards making the manufacturing units aware of these new technologies so that they can cater to the global market as per the global standards. Philippines is an important market for India, particularly in the ASEAN region, and we hope that today's meeting will be able to sensitize the audience about the immense opportunities which Indian medical device sector has to offer. The healthcare sector today is at the front line due to the recent COVID-19 pandemic, and India, like many other countries, is working towards overcoming the challenges faced by this pandemic. To give an example, at the advent of COVID, India was importing most of the PPE kits. However, within a very short span of time, we became the world's second largest PPE producer. I once again take this opportunity to thank the Embassy of India in Philippines, Business World, FICCI, for organizing this program, which will help in creating better understanding of the potential partnership in healthcare and medical device sector. Thank you once again for giving me this opportunity, and I look forward to hearing the views from the eminent speakers present at the forum today. Thank you so much.
Thank you very much, Mr. Arun Kumar Garodia of EEPC India. This time, to share with us a special address, let me introduce to you Ms. Alma Jimenez, Management Association of the Philippines, Health Committee Chair and Conference Committee Chair.
Good afternoon to the distinguished guests from the government, the Philippine business community, the civil society and the media, our friends in Business World and Philippine Star, and those who are joining us from India. And that greeting is warmly extended to those who are with us today at this hall of the Shangri-La at the Fort, and to those who are joining us via Facebook and other social media platforms. On behalf of the Management Association of the Philippines, let me first congratulate the Embassy of India in the Philippines, the Business World Insights, the Federation of Indian Chambers of Commerce and Industry, and the Philippine Chamber of Commerce and Industry for organizing today's Philippine-India Business Conference on Healthcare and Medical Cooperation. The pandemic halted the world in its tracks, and as we slowly reopen the global doors to restart, it is quite appropriate to hold this conference about healthcare, the industry that took the spotlight in battling COVID-19. Our health human resource continues to rise to the challenges, but the fight took its toll on our health systems. It revealed many gaps that need to be addressed if we are to prevent or to better manage global health risks that may happen again in the future. Gatherings like these are critical in encouraging exchange of ideas on how the global community can work together to strengthen health systems, and possible collaborations such as addressing looming health human resource shortages, financing health services, accelerating the momentum for digital health, research and development for medicines, vaccines, and devices, shifting the focus from curative to preventive and wellness, in tourism also, are among the identified top priorities for investments. We share your optimism that having these discussions in this conference will yield positive outcomes, both from the perspective of possible investments and business cooperation, and in further solidifying the long-standing relations between India and the Philippines that started in 1952. India is one of the countries the world turned to during the pandemic, and its quick response is a boost in this crisis, particularly in the subsectors of health services, pharmaceuticals, and medical devices. The MAP counts among its members business leaders who represent top corporations, many of which have global presence. Each has the capability and capacity to be partners, service providers, or product suppliers, or even clients for healthcare businesses. We would certainly welcome the opportunity to engage. Let the presentation speakers and the panelists today become springboards to identify business opportunities in these health subsectors, because truly, we can only recover if we work together for solutions that can benefit everyone. We also hope that you can join us in September when MAP holds its 2022 CEO conference. The health sector will be tackled as among the industries that delivered wins in the midst of change. So with that, let me wish everyone a fruitful discussion and successful conference. Thank you very much.
Again, thank you very much, Ms. Alma Jimenez of the Management Association of the Philippines. This time, we are also honored to have with us virtually His Excellency Ramon S. Bagatsing Jr., Ambassador of the Philippines to India, to give his opening address.
Honorable Shambhu Kumaran, my good friend, Ms. Alma Jimenez, Mr. Arun Garodia, Kartik G, Mr. Wilfredo Reyes, distinguished officials and esteemed colleagues from the government and business sectors and partners. Namaste from India. At the outset, I'd like to express my appreciation to the Embassy of India in the Philippines, the FICCI, the Engineering Export Promotion Council, Business World, MAP, BCCI, Indian Business Forum, Philstar, for organizing this conference. The Philippine Embassy in New Delhi recognizes the significance of this event to promote Philippine-India emerging partnership on healthcare and medical cooperation. We have immense growth opportunities in these sectors, as we have seen in the past. President Duterte recognizes India's leading role as a global producer and a source of affordable, accessible, available medicine. He even commended the Indian government under the able leadership of Prime Minister Narendra Modi for allowing India's export of pharmaceutical products to the Philippines. This is an affirmation of India's commitment to further strengthen its relationship with us. I also wish to note that in 2018, the Philippines was evaluated as the 11th most attractive market for pharmaceutical companies and the 3rd most attractive market among ASEAN countries. It is to be expected that in the light of the current pandemic, the Philippines' health expenditure will continue to rise due to hospital expansion and spending on healthcare services by the government and private entities, which in turn opens a window of opportunity to other local and international pharmaceutical companies to fill in these gaps. As one of the largest pharmaceutical markets globally and the 4th largest medical device market in Asia, India may wish to join the race and take advantage of this opportunity as it continues to expand its presence in the region and beyond, consistent to the mutually recognized efforts to develop accessible and affordable healthcare sector. At present, India has a strong presence in pharma in the Philippines, where major firms like Dabur Pharma, Lupin, Torrent, Sidus Cadila, Claris, among others, have set up liaison offices to promote their products. Relevant to this discussion, I would just like to share that the embassy is currently facilitating the discussion between the Philippine General Hospital and the Apollo Hospitals group here in India on the initiative for cancer patients. The PGH is proposing to build a 200 to 300 bed capacity dedicated cancer hospital. The project will be initiated under the PPP scheme. Dr. Ligaspi is one of the speakers later. And Apollo Hospital Group, among others, have expressed its interest to join the bidding process to acquire said project. This partnership would greatly expand the capacity of the PGH to treat cancer patients, which will in turn become accessible to all underprivileged Filipinos. This is a window of opportunity. I would like to touch on some specifics because yesterday I just met with Mr. Satyana Vayana Reddy, President of the New Initiatives of Apollo Hospital, and Dr. Harinder Sidhu about their interest to join the bidding for the expansion of the PGH. And also they manifested their interest in either establishing a nursing school or enter into a joint venture with an existing nursing school in the Philippines. As we all know, one of the most demanded nurses in the world are the Filipinos. In addition, they're also looking at possible exchange programs for doctors, prospective investors that can tie up with Apollo to further expand this healthcare and medical cooperation, particularly in areas of medical tourism, equipment and devices, telemedicine, among others. This is also open to Max, Fortis, and the other major players here. Government provides the policy, provides incentives, gives you the programs, but what is most important at the end of the day is to encourage a B2B undertaking, a B2B relationship. So all this is a welcome development, and we encourage other investors from India to explore our healthcare sector. May I just emphasize that according to the BOI, Board of Investments, foreign investors for hospitals and other healthcare facilities would be provided the following incentives: income tax holiday for 4 to 7 years. After the income tax holiday, enhanced deduction for 5 years that shall be determined relevant and applicable to the registered project under the Philippine Strategic Investment Priority Plan, pursuant to Republic Act 11534, as follows. Additional depreciation allowance of the assets acquired for the entity's production of goods and services, which is 10% of building and 20% for machineries and equipment. Additional 50% deduction on labor expense. Additional 100% deduction on research and development expenses, which is crucial in any undertaking, especially in this sector. Additional 100% deduction on training expense. Additional 50% deduction on domestic input expense. Additional 50% deduction on power expense. Deduction for reinvestment allowance to manufacturing industry, as long as the amount reinvested is to a maximum of 50%, and enhanced net operating loss carryover, and duty exemption on importation of capital equipment, raw materials, spare parts, or accessories, which within a maximum period of 12 years from the date of registration for domestic enterprises. This signals the Philippines' serious desire to promote itself as the regional headquarters for pharma. With 1.3 billion people in India and about 650 million citizens in ASEAN, you would have about 2 billion of the world's citizenry. I think that's a very big, attractive market. So we hope that our friends in India would consider Philippines as an option, even when you do try to establish your regional headquarters in ASEAN. As one of the speakers said earlier, we have some competitive advantages over our other ASEAN brothers. And definitely, we have even the signals. We have a Virus Center Proposal Institute in Clark. You already have an economic zone in Bulacan that caters exclusively to this pharma sector. And just imagine the direct benefit of our people in the Philippines, wherein we can have what you have in India: affordable, accessible, available, good, top quality medicines. Forget the big pharma talk about India products not being top quality. These are technical licenses issued by Western countries for their products to be manufactured here in India. So obviously the cost of medicines will go down. How much would RT-PCR be? It's only 300 pesos here in India. Remdesivir, the other medicines. This is the challenge. This is what we should look for, to give quality, affordable, accessible, available medicines to our Filipinos. So with that, we hope that there will be more B2B undertakings. We have to establish, aside from the numbers and the profits and the spreadsheets, we have to establish comfort levels and trust in doing business with each other. We have done this. We have traded more than 1,000 years ago. Maybe not as complicated as it is right now, but we had such long history with India and the Philippines. We did business with each other more than 1,000 years ago. And there is no reason why we cannot rediscover the ties that bind us before. We have to rediscover the ties that bind us. We have to trust and work with each other and be comfortable with each other and convert all these interesting seminars into concrete action and particular specific undertakings. Ambassador Kumaran and I are here to help in any way that we can. We have to dare in order to reap the rewards. And as always, we are here to be of service to all of you. Mabuhay and namaste.
Thank you very much, Ambassador Bagatsing. Now, last but definitely not the least, I am very honored to welcome His Excellency Ambassador Shambhu Kumaran, Ambassador of India to the Philippines, who will deliver his opening address.
Namaste, Mabuhay. Very good afternoon to everyone. It's a delightful feeling to be back on stage in front of real people rather than virtual ones. So let's all pat each other on the back for having made it here. Thank you for each one of you for joining. Let me begin by recording our most sincere appreciation at Mr. Wilfredo Reyes, Editor-in-Chief, Business World, and his team for partnering the embassy in setting up this event. I think that this is the beginning of a partnership, and I'm sure we'll be able to have quite a few more structured conversations. I'd also like to acknowledge my collaborator in Delhi, Ambassador Ramon Bagatsing Jr. Always a pleasure to see you, sir. He was here a few days ago, so we did catch up quite a bit and hatch a lot more conspiracies together as to how to take our relationship to newer heights. And my colleagues in government, Mr. Jayesh Ranjan, Principal Secretary Industries of the State Government of Telengana, also a partner for today's event, and Mr. C. Rajshekar, Officer on Special Duties of the States Division of the Ministry of External Affairs, Ms. Alma R Jimenez, Management Association of the Philippines Health Committee Chair and Conference Committee Chair. Thank you for joining us and conveying the support of MAP as a partner. Mr. Rajagopal of FICCI and Mr. Garodia of EPC are other partners. And our local partners here, India Business Forum, able President, Mr. Dilip Tiwari, Federation of Indian Chambers of Commerce and Industry. I think I saw Chairman Rex Daryanani here. And all other partners who've been working closely with the embassy on this ambitious agenda of transforming India-Philippines relationship and taking it to a new level. I think it would be fair to say that today we are probably at the best phase in the India-Philippines relationship. It is something that has emerged in a quieter way, perhaps, not as much noticed, but definitely the pandemic was one of the drivers because it underscored, I think, in the Filipino mind, the value of the India partnership. And for India, as we looked at the emerging geopolitics of the Indo-Pacific and the geo-economics of the Indo-Pacific, we see the Philippines very much as one of the most significant partners for India in our Act East policy. And the mandate for us in the embassy is to make Philippines India's best partner in ASEAN. We'll do everything that we can to make that happen. This is a relationship that is now spanning multiple sectors. But I trace the real dynamism and the depth of the relationship to primarily two factors. Firstly, of course, very strong commitment at the leadership level. Prime Minister Narendra Modi of India and President Duterte of Philippines have had several conversations. And out of those conversations, they have both underlined their deep interest in a stronger partnership. But even more important for us is that this is a people-driven partnership. As two democracies, we see the richness of our people-to-people interactions. And the set of people that you have here perhaps represents that, and people are watching us virtually. And I'm told that we have a very large turnout of over 300 plus people joining us for this conference. So that represents, for me, the real fundamental strength of the India-Philippines partnership, the multiplicity of people-to-people connections, whether it be in terms of business, in terms of familial relationships, culture, and this is not going to diminish, and I see it increasing in momentum in the years to come. So we are in a good space, and we are moving to an even better space in the India-Philippines relationship. As Editor Reyes said, healthcare post-COVID is at the center of global discourse. And it is very appropriate. The embassy, over the past year and a few months, we've organized at least 10 sector-specific business conferences. This is perhaps the first real hybrid conference. And it is very appropriate that it is on healthcare, because it, to my mind, reflects a certain crossing of a certain Rubicon in our minds, that we have not reached the end of the COVID phase, but as the editor said again, we're perhaps at the beginning of the end. Let's hope that that is so. One of the things that COVID brought to the fore was the sheer vulnerability of countries such as India and the Philippines in terms of our supply chain dependencies. India, at the beginning of the pandemic, did not make any PPEs, for example. We found ourselves, even on APIs, which are essential to make the medicines, we found deep vulnerabilities. Of course, it's a matter of pride for me to say that under Prime Minister Modi's leadership, we've taken decisive action today to be able to generate these materials, not just to meet the demands of India's very large market, but also to share it with our partners. So the deep-seated vulnerability that was highlighted by COVID in terms of supply chains, it requires a response in the coming days. And that response, let me suggest to you, is to build partnerships that you can trust. And I believe that there is a deep element of political trust between India and the Philippines. And if you remember, there was a time initially when India was exporting more vaccines than it had administered in India itself. During the pandemic, we have supplied medicines. Some of you may recall the initial hydroxychloroquine phase, all the way down to the current anti-COVID medicines. Across the space, despite India's great internal requirements, India has supplied these medicines to 150 countries across the world, including vaccines, both bilaterally and under COVAX. So therefore, I suggest to you that in the new world, when you look at partnerships of trust and building supply chain redundancy, look at India. And we definitely would think that this is a partnership that we can build with the Philippines. There have been various mentions about the remarkable transformations that are underway in India's healthcare sector. There was mention about universal healthcare, new health policy, but also very pointedly a reference was made by the CEO of Manipal Hospitals about the digitalization of healthcare. And I was able to also put out an article a couple of days ago on this very topic. I think if you look at specific areas in which strong partnerships going beyond buyer-seller relationships can be established, it is definitely one of the areas is to look at healthcare, health tech partnerships between Indian and Filipino entities. So therefore, in approaching this issue, we decided that we would want to have a comprehensive conference on health, but also segment it into 3 specific areas of healthcare, pharmaceuticals, and medical devices. Because there are overlapping interests here, but at the same time, these are specific areas. I know one of the hospitals here, one of the Indian entities, Nephroplus, very quickly has ramped up on dialysis. They probably reached 20 centers in less than 20 months. So it's just a sign that there is enormous untapped requirements and capabilities on both sides. What I'd like to conclude by saying is to reiterate the point as to why should the Philippines look at India. Firstly, as 2 democracies, we recognize that our people need accessible healthcare. They need affordable healthcare, and they need healthcare to be available. This is only possible if we look at value in partnerships, looking beyond the immediate value to the transaction, value to society. And this is something that's going to be fundamentally important in the new normal, in the new society that we seek to build post-COVID. Secondly, India is a growing technological power. And this technological power of India is manifesting in health tech, in edutech, and I've been having conversations on fintech and agri-tech. Across the tech space, you find that there are various Indian entities, nimble, sharp, young, driven, and looking at new geographies like the Philippines. So I urge all our Filipino friends here, I don't want you to look away from where you've been looking in the past, but I want you to also look at India as a strong partner. The third, I think I mentioned, is the element of trust. Between India and the Philippines, the relationship is multi-sectoral and it is dynamic and it is going to grow. So you can trust us as a partner, and I do believe that in India there is greater and growing recognition of the importance of Philippines. So look forward to more Indian presence and participation in your activities. And the last point I'd just like to underline is that there is a deep similarity in our social situation and our economic situation. Secretary Dominguez, every time I meet him, he says, "Oh, Ambassador, India and the Philippines are alike like no other 2 countries on the planet." My Prime Minister talks about the 3 Ds of democracy, of demand, and in the case of the Philippines, it is definitely the same. When you talk about demography, democracy, and demand, it's the same 3 Ds that apply. You are a very young country. Your demography is very similar to India. It's a very young country. Your democracies, our interests have to percolate to ensuring that the last person, those interests of the last person on the street are addressed by our political system. It cannot survive by addressing only the elite segment or some other segments. And the third thing is definitely both of our countries are consumer-driven societies. So look at it this way. Look at the pathways. You can have investment from India into the Philippines, but you can also have investments from the Philippines into India. This has already happened in some sectors. Even in the pharmaceutical sector, Filipino companies have already invested in India. And there are multiple opportunities for investment. Secondly, trade across this space can develop. Third, technological partnerships. Please look at your requirements, look at what is happening in the innovation space in India, engage early, adopt quickly. We believe that a people-driven Philippines-India partnership is a certainty in the future, and I'd like to invite each one of you to be a partner in the journey. Thank you very much.
All right, thank you very much, Ambassador Kumaran. Again, a very insightful opening address there from the ambassador. And of course, thank you to all of our distinguished guests for joining us here physically this afternoon. And while we're at it, and while you guys are still on stage, let's take this time for a quick photo opportunity. All right, so let's have a quick photo opportunity. Mr. Wilfredo Reyes, again, Ambassador Kumaran, and of course, Ms. Jimenez. All right, so that's just the start. Thank you very much again to our guests. Please join us for the rest of the program. You may now again take your seats. Thank you very much. Okay, this time we are going to proceed to our panel discussions. For our first session, we will tackle the opportunities for engagement between India and the Philippines in the healthcare services sector. Now, the healthcare industry in India comprises of hospitals, medical devices, clinical trials, outsourcing, telemedicine, medical tourism, health insurance, and medical equipment. The sector is growing at a tremendous pace owing to its strengthening coverage, services, and increasing expenditure by public as well as private players. Meanwhile, despite being significantly challenged amid the COVID-19 pandemic, the Philippine healthcare industry has been growing too. Now, one of the most primary developments recently is the signing of Republic Act 11223, more commonly known as the Universal Healthcare Law 3 years ago, which allows every Filipino access to preventive, curative, rehabilitative, and palliative care under the government's health insurance program. We are honored to have with us in this session respected experts from India and the Philippines, starting off with our first speaker, Dr. Karan Thakur, Vice President for Public Affairs at the Apollo Hospitals Group, that is Asia's largest integrated healthcare provider. He is a seasoned healthcare administrator with wide experience in the field of health policy, hospital operations, healthcare projects, health communications, and strategy. Again, let us all welcome Dr. Thakur.
Thank you. Kumusta and Namaste from India. We are delighted to be participating at this India-Philippines Business Conference on Healthcare and Medical Cooperation. At the outset, I must begin by thanking the Indian Embassy in Manila, His Excellency, the Ambassador to the Philippines, the Ambassador of the Philippines to India, and also to FICCI for bringing us all together onto this platform where we can discuss how to deepen and widen the relationship between India and the Philippines. And as His Excellencies, both the Excellencies mentioned, that there is an old relationship between our two countries which goes back to the 9th and 10th centuries. And it is only but prudent on our part now, as we emerge out of the pandemic, to deepen that relationship in the space of healthcare, medical technologies, pharmaceuticals, and other related areas of common interest. I must step back before we get into areas of potential opportunities to talk a little bit about my organization, the Apollo Hospitals Group, which is Asia's largest integrated healthcare services provider. Our journey started in the year 1983, and in the intervening nearly 4 decades that we've been in existence, we have about 70 odd hospitals and manage and own and operate around 10,000 hospital beds. So this capability gives us the length and the breadth of reach and accessibility across the Indian subcontinent. And we've endeavored to provide quality medical services to each Indian and then expand that to become a global citizen and a global institution of repute to provide healthcare services to the entire world. And we are very proud that we have had nationals from across 120 countries who have come into India, into one of our hospitals to seek care. And this care is given across 4 major pillars that we look at and we focus on. One is on clinical excellence. The quality of the Indian doctor, the Indian nurse, the Indian paramedic is well known and established across the world. And these services that we provide at our hospital group helps ensure that those standards which are established the world over, whether it's a Cleveland Clinic or a Mayo Clinic or the NHS, or even closer home to the leaders in healthcare in the Asian continent, are replicated in India and are done so at a fraction of the cost. The second is the technology that we bring along with that clinical care to dovetail that clinical care. We have amongst the class-leading technologies, whether it is in oncology services or it is in radiation therapy or even diagnostics. Our Apollo Proton Center in Chennai is the first of its kind in this region, which looks at providing precision care for oncology, especially pediatric oncology for the world. The third aspect is our tender loving care is the service excellence aspect of it. How our nurses, how our doctors, how our paramedics treat patients. And I know that this is something quite similar in our cultures in India and the Philippines, is how do we ensure that we provide a welcoming and caring environment for not just patients, but any guests that come to our country, and that is replicated in our hospitals as well. And fourth is obviously the edge that India holds in terms of providing quality care, but at an affordable price. So when we bring these four pillars together, it is what is the DNA and the essence of Apollo Hospitals. And we're very proud that the partnership between India and the Philippines has given us some tremendous results. Just in the area of solid organ transplants, my organization is the leader in organ transplants in the world, and we have been providing those services which are currently not available to the level and standard in Philippines and in the hospitals there in India. Close to 100 liver transplants are being done in India at our hospitals across the major hospitals in India. Just last year, we had 30 children, babies in fact, who came from the Philippines, and we are very thankful to governments on both sides for facilitating visas, transfers, and ensuring a biobubble transfer for these very vulnerable patients that could actually seek help even during the peak of COVID, which just tells us about the deepening of the partnership, the trust that exists on both sides, and also the facilitation that is being offered by the embassies, by the governments, and through cooperation by institutions like FICCI, that 30 children in a span of a year during the worst of the pandemic could actually come, get treated, and through God's grace and the inputs of our surgeons could be treated and are now safely back in the Philippines. When the President of India visited the Philippines, he actually did visit some of these children, and they called on him, and they were very thankful for what was made possible between the two governments and through hospitals like ours. So there is a wealth of experience that resides in India. There is a lot of dynamism in our healthcare systems to collaborate, to cooperate, and just a few areas that we are looking at very keenly. His Excellency, the Ambassador of the Philippines to India, outlined some of these areas in capacity building as a whole, and more specifically in nursing education, nursing training, which could happen both of Filipino nurses in India and through our investments and opportunities in the nursing education framework in the Philippines itself. The second is to look at how we can establish centers of excellence of various specialties in the Philippines, and obviously build on the relationship that we have in medical value travel, and bring even wider demographic of the Filipino population into India to provide them with the cutting edge care as the Filipino health system further develops these super specialties like liver transplantation, etc. One specific area of interest for us is also oncology. We understand that that's a growing demand for oncology services in the Filipino population, and we'd be happy to expand that as we go in this relationship in the years ahead. The last area where we are very keen, which was touched upon by Mr. Rajgopalan, is on medtech and e-tech and mobile health technologies. We've created a new platform called Apollo 24/7, which is a unified platform for all our health services portfolio. And we'd be happy to bring similar technologies into Philippines to help expand the reach of health technologies and health services being made available to every Filipino, as we jointly look at how can we provide universal health coverage to our large and diverse populations, both in India and the Philippines. With these brief remarks, I'll just hand it back to the moderator and would be happy to take questions on the areas that we've discussed or any other areas that might be of interest. So thank you once again for having me here.
Thank you very much, Dr. Thakur. Of course, we will hear from Dr. Thakur more later as we start our panel discussion. But this time around, let's hear from our second speaker, Mr. Christian Argos, President and CEO of MaxiCare Healthcare Corporation, one of the pioneers in the health maintenance organization industry in the Philippines. Now, prior to joining MaxiCare, he held various positions within the Equicom Group, including President of Equicom Shared Services and My Health Clinics. Please welcome Mr. Argos.
Good afternoon, everyone. Ambassador Bagatsing is joining us from India. His Excellency, Mr. Ambassador Kumaran, Editor-in-Chief, Mr. Reyes, and to our colleagues in the private and public sectors in healthcare, thank you for having us here today, and thank you for joining us today. I really appreciate having the opportunity to join this conference together to talk about and to share ideas about cooperation in healthcare and medicine. I think one important insight that we've drawn from the pandemic is that healthcare is a system challenge. It's not an episodic challenge. It's not an individual challenge. And as such, cooperation is very important. Collaboration is very important. One of the things that has happened during the pandemic is the acceleration of cooperation. Because as you can see in an ecosystem, in a system, a vulnerability in one area threatens the entire system. And we've seen areas where we need to improve as a country and as a global community. And forums like this help us brainstorm and help us strengthen these areas and these gaps. We talk about health tech, and I think that's one very, very, I think, striking opportunity for us as a country again, and as a global community. And when I talk about health technology, health tech, it's not just about telemedicine. It's about the services that support the medical community in the allocation of resources and the provision of care and service. We've had the fortune of working with Indian companies during this pandemic to help us process information that we've captured across 1.7 million members. As an HMO, we generate a ton of data. There are an average of 4.8 interactions per member per year. So you can imagine the amount of information, the wealth of information that we have on an individual and population level. And we have a team in India working with one of our key suppliers that helped us stratify risk by population, subgroups, and by individual. And this allowed us to deploy specific intervention to these subgroups and to these people. So I think that's really a tremendous opportunity for us as a country, because as we implement universal healthcare, it's all about also resource allocation and prioritization. And it is our role to define what primary care is in the context of universal healthcare, because there is no single definition of primary care. Primary care has to be tooled towards the needs of the population. And this is really where the strength of countries like India, who have a long and rich heritage in information technology, and really share that with the Philippines and leverage the data that we are generating now. The other thing that I'd like to share as well that's been very interesting is that there's been a very dramatic shift towards telemedicine. Overnight, literally overnight, in the first 2 weeks of the pandemic, teleconsultations grew 20-fold. And during the last Omicron surge in the first quarter of this year, the first 2 months in particular, we've had call volumes of about 100,000 consultations coming into just our own dedicated teleconsult team. And we're not the only provider. There are many other public and private providers of telemedicine here. And each of those interactions generate a ton of data, but data that is yet to be transformed and made useful so that it can be actionable. And once we go through that information and socialize it with our partners, both locally and in India and the rest of the world, we can now calibrate, our focus areas. Where should we invest our limited resources? One thing that's, as a private payer, it's we're keenly aware that resources are limited. When you look at the typical HMO member, we have an allocation of about 12 to 14,000 pesos per person per year. That's not a lot. It's not a lot. So how do you stretch that budget? And the data will inform us on where the investments have to be made. Do we invest in shoring up capacity for pharmaceuticals? Do we focus on metabolic diseases and management of lifestyle diseases? Do we shift investments towards preventive care as opposed to curative care? And which diseases really drive bulk of the expenses? COVID is an infectious disease, and a lot of money went into COVID. But it also, I think, underscored that we have to address long-term lifestyle diseases. We've seen that if you have a comorbidity, specifically hypertension, the risk goes up. COVID may go away, but hypertension is here to stay. So again, it really points us towards the right direction. Where should we invest? And again, it's through events like this, it's through dialogue like this that we get to socialize information and again, work together towards shifting resources where we get the best bang for our buck. So with that, thank you again, everyone. I look forward to the Q&A portion. And maraming salamat.
All right, thank you very much again, Mr. Christian Argos of Maxicare Healthcare Corporation. We'll hear from him more later. This time, let's proceed to our third speaker, Mr. Vikram Vupala, founder and CEO of Nephro Plus, India's largest dialysis network. Now, after spending 10 years in the US healthcare industry, his passion to redefine healthcare delivery in India prompted him to found Nephro Plus in 2010. He has expanded Nephro Plus to Asia's leading dialysis network of 250 centers in 150 cities across 4 countries. Please welcome Mr. Vupala.
Thank you so much. And good afternoon to all the audience and the esteemed panelists and the ambassadors. To introduce myself, Vikram, I'm the founder and CEO of Nephro Plus. It's a 12-year-old startup, so to speak, and we are co-founded by a patient on dialysis called Kamal. And the way we envisioned is that people on dialysis across the world should lead a normal life. That's the fundamental premise of the network. In a brief period, so to speak, of 10 years, we have expanded very aggressively. The first 8 years has been focused exclusively in India, where we built a network of 270 centers, now spread across 175 cities, right from the Jammu and Kashmir to Kanyakumari, from Northeast Guwahati to Surat. And about 2 years ago, we looked at the Southeast Asia region, the CIS and the Middle East, and we're very happy to say that our first overseas expansion in Southeast Asia region is in Philippines. So we, as His Excellency Mr. Kumaran mentioned, we have grown very fast in Philippines. Our network is now 20 centers in just 20 months, and we are in the process of investing much further over the next 3 to 4 years to take it to a network of 50 to 60 centers in 50 to 60 months, so to speak. We have already invested close to $25 million in Philippines, and we are on track to invest another 75 to 100 million over the next 3-4 years. And And the whole premise around quality care, but also accessible and affordable, is very close to us. In India, before Nephroplus created the network, dialysis was primarily available in the top 15-20 cities of the country. But our vision was to enable access in the tier 2, tier 3, tier 4, and tier 5 cities of India. And now our network in India is 175 plus cities. So in a similar way, we want to provide improved access to dialysis in Philippines as well, where we want to go beyond Metro Manila to many other provinces across the country. What my team tells me is the dialysis capacity is a little bit lopsided right now. When you compare it with a percentage of population, there is far more capacity in Metro Manila than beyond Metro Manila in the Philippines. So our aspiration in Philippines will be to address that lopsided supply and demand. And over the next few years, we'll be focusing, of course, on Metro Manila, but beyond that, we will invest aggressively in the beyond Metro Manila areas. I would also like to say that we have recently partnered with the government of Uzbekistan, where we will be managing the entire country's kidney disease burden, right from building the world's largest dialysis center in Tashkent with 160 dialysis machines to investing in prevention of kidney disease, because we fundamentally believe that the only way, as Mr. Argos has mentioned, is where to invest as a payer is not just in the curative side or the acute side, but also on the prevention side. So we are helping the government of Uzbekistan in managing how to reduce the future burden of kidney disease. So that's a very exciting opportunity for us, where we'll be addressing the entire country's kidney disease problem, including, of course, the dialysis provision. We also have partnered with 3 state governments in India to manage the dialysis burden in the government hospitals, and another 7 PSUs, where these are captive large employers like steel companies, mining companies, where we manage their entire dialysis burden in a public-private partnership model, which has been very successful in India. And I would recommend the stakeholders in Philippines as well to look at public-private partnership model as a way to bring efficiency, access, and quality to the country's disease population. I think at this point, I would just like to say that we have also built a technology stack for the entire stakeholders in the ecosystem, right from patients engagement to the doctors engagement to the employee engagement to the payer engagement in the kidney disease ecosystem. And we are happy to collaborate on this technology stack to collaborate and share our technology stack with the healthcare providers and payers in the Philippines ecosystem. And I hope that with the great start that we have had in Philippines of 20 centers in 20 months, we will be looking at 50 centers in 50 months and taking it to the next level. And as the speakers earlier have said, the two demographies, we have to look at on the demand side as well. We have to look at further cooperation between the government of India, the government of Philippines, and the private service providers, private corporations in India, and private service providers and corporations in Philippines. With that, I'm happy to answer any questions as the panel proceeds. Thank you.
Thank you very much, Mr. Vupala. Again, we'll hear more from him later in our panel. This time, let's go to our fourth speaker, Mr. Rafael Jaime Resio. He is the head of corporate strategy and development at AC Health, a wholly owned subsidiary of Ayala Corporation that aims to build an integrated healthcare ecosystem that improves the healthcare for all. He oversees the overall healthcare investment portfolio of the company and sits on various boards of investing companies across the AC Health Group. Please welcome Mr. Resio.
Hi, good afternoon, everyone. First of all, I'd like to thank the organizers for allowing us the opportunity to be in front of such a distinguished roster of guests and panelists. I'll start by introducing AC Health. As many of you know, AC Health is a member of the Ayala Group of companies. We are the youngest company in the Ayala portfolio. We operate in 3 distinct business verticals now. We have a pharma group, we have a clinics and hospitals group, and then we also have a digital health arm as well. I'd like to note that we've inherited a lot of the Ayala Corporation's DNA now, and that we've built our portfolio and our business through a lot of different partnerships throughout the years now. So for example, when we first invested in the pharma space back in 2015, we partnered with a former Ayala executive who put up the Generica drugstore. Within the pharma space as well, we also invested in a company called IE Medica and MedEthics, which is actually owned and run by an Indian national named Basant Salyan and his wife Mona Salyan. And so I think that we have built, I guess, strong partnerships throughout the years, and just I think that that's going to be part of our DNA moving forward. On the clinics and hospitals front, we do have an interest there as well. We have the Healthway chain of clinics, mall-based clinics and primary care clinics. And we recently invested as well in the Polymed network. But we're also excited to say that we are putting up the first cancer hospital here in the Philippines. And it's in partnership with CTSI, Cancer Treatment Services International, which runs the American Oncology Institute chain of hospitals out in India now. And so I think that our group already has developed significant ties to the nation of India, and we do look to India a lot in terms of inspiration and learnings as well. Lastly, we also have a digital health group, and here we have, I guess, healthcare super app that we've started alongside our sister company, Globe Telecom. It's called Health Now, and it's envisioned to be an all-in-one healthcare super app that allows you to do teleconsults, medicine deliveries, home diagnostics, and all that. And you'll notice that we've sort of invested broadly across the industry now. The goal really is to be able to develop this integrated ecosystem, wherein we want to address the fundamental gaps in accessibility, affordability, and quality of healthcare that exists for many Filipinos today. Ultimately, our goal is to be able to serve 1 in 5 Filipinos by 2030. And I guess in terms of building out this ecosystem, I guess when we were charting out our strategy, we looked towards many different countries to seek inspiration, I guess. And I guess that when we look at India and Apollo, for example, as one of the leaders there, we saw a lot of similarities in terms of per capita statistics, in terms of number of doctors per 1,000 population. But what struck me was that despite all the similarities, I think, and this is a striking stat to me, is that the typical Filipino sees his doctor 0.7 times per year, whereas the typical Indian national goes and sees a doctor maybe 3 times a year. So it's staggering that despite the similarities, we have seen, I guess, difference in behavior, and a lot of that could be down to accessibility, could be down to affordability, and that's something that over time we want to be able to address. I'll spend a little bit of time talking about the cancer hospital now, and I think that when we looked at the major disease burdens here in the Philippines, we saw that one of oncology or cancer was within the top 3 in terms of the leading cases of morbidity in the Philippines. And we saw that given the facilities here, there's a National Kidney Institute, there's a National Heart Institute, there's a National Lung Institute, but there was no, I guess, Cancer Institute at the moment. And we saw that glaring gap. And we wanted to be able to sort of do our part in addressing accessibility and affordability for this specific disease burden. And so we're opening the first dedicated comprehensive cancer center here in the Philippines. The vision is to be able to offer the best value private hospital for cancer care, managed by a leading roster of healthcare professionals. As mentioned earlier, we partnered with CTSI, which is a leading oncology group in India. They operate 10 cancer hospitals across India and Sri Lanka. And we will look at them now in terms of just learning, I guess, clinical delivery, oncology services, and just like understanding how to better deliver care for this disease burden. And I'll touch on it lightly as well, but we talked about IE Medica and MedEthics as our importation and distribution arm. They source a lot of generic medicines across the globe, but primarily out of India. And we saw this as an integral part in us securing our supply chain, not just for our retail pharma, but also for our hospitals and clinics now. And especially when we look towards launching our cancer hospital next year, being able to bring in quality generic oncology medicine to be able to significantly bring down the cost of treatment in the Philippines is something that will be very integral to us now. So I'll end by saying that I think there are a lot of similarities between the Philippine and Indian healthcare systems. And I think that it was touched on earlier, but the after effects of this pandemic will not only accelerate an increase in healthcare spending, but it will also prompt an emergence and acceptance of new healthcare delivery models, whether it's in digital or new formats and the like. And I think that this will provide us very ample opportunity to explore partnerships between the Philippines and India. And as mentioned, as AC Health, our DNA is we want to work with the best partners that we can. And we're looking forward to the opportunity to collaborate with your groups as well. So with that, thank you, and I look forward to the Q&A session.
All right, thank you very much, Mr. Resho of AC Health. Now, this time around, let's take a deep dive into how the Philippines and India can cooperate when it comes to providing health services here. So again, we are asking the members, if you have any questions, feel free to raise your hand, and some of our crew members are going to approach you so that you can at least give your question to our panel members. So this time around, of course, during the panel discussion, one of the more common themes that was raised among all our speakers here would have to be how the pandemic accelerated the use of telemedicine. While that is specifically true, especially even in the Philippines, one of the main challenges here would have to be how digital infrastructure has yet to catch up in the Philippines in order for us to fully realize the potential of telemedicine. So this time around, let me address my question to Dr. Thakur. Based from your experience in India, what do you think are possible rooms of improvement here? How can we possibly work around the digital challenges here in the Philippines in order for us to fully accelerate telemedicine?
Okay. Thank you for that question. If you see where India was pre-pandemic in terms of adoption of telemedicine or of m-health services, we face challenges of the providers not being available to service the demand. And the demand itself was also quite skewed, where there was a rise in the urban demand for telemedicine services, even in the pre-pandemic phase, but not so much from tier 2, tier 3 cities, where actually the need for telemedicine is the most fed. But the pandemic changed that, and it is not just because of the lockdowns or because of other restrictions, but also because the providers made themselves available, and the demand was also seen agnostically across the length and breadth of the country. The second thing that has happened is that there has been a regulatory push from the government and the state governments to create a conducive environment, whether it is through the National Health Digital Mission that was launched earlier this year, which built on the National Health Stack as part of the National Health Agenda, which helped bring providers on a common platform of reporting and also making bandwidth available to use for health service delivery models to be adopted was a major step for the telemedicine adoption that we saw in the past couple of years. The other evolving thing that one is seeing in the regulatory landscape is of a standardization of EHR, the electronic health records. And I think that is very important for any country or health system because that encourages more and more patients to come forth, share information, and know that this can easily be shared across the health system, whether it is from the primary to the tertiary or between providers itself in a secure manner. So I think one is the technical aspect of it, and as we've seen, the adoption is quite high now that we are using platforms which are akin to social media platforms, and that has a lot of demand generation, but also to build a health stack. As my colleague Mr. Vupula was saying, that they've created a health stack for everything that the stakeholders would need for nephrology services. That needs to be replicated across the health system to show real advantages of what telemedicine, mHealth, and eHealth can offer for every citizen.
That Dr. Thakur. Now, Sir Christian, earlier you were talking about how teleconsultations have grown exponentially over the course of the pandemic for the past 2 years. Just give us an idea. What were the main challenges here that you encountered when it comes to the use of teleconsultations, and what was your major workaround, and what do you think are the main gaps here that could provide an opportunity for a possible collaboration between India and the Philippines?
That's an interesting topic, because when you look at telemedicine, there's an analog for that. It's actually customer interaction services, which is what the BPO industry is now. With Indian experience and the Filipino customer-centric service nature, we've built the Philippines to be a market leader. And that kind of philosophy has to be transplanted into medicine, and in particular, telemedicine. When we first started out with telemedicine, it was a steep learning curve. Aside from the technology side, it's about the interaction side. When you look at healthcare in the Philippines, the doctor will do a consultation. After the consultation, the doctor will give you either a prescription or a referral, and that's it from the doctor's end. But what we've learned from the BPO industry, we've learned to really be conscious about concepts like first call resolution, SLAs. And you need to apply that to telemedicine to deliver a good patient experience so that people come back to telemedicine and people try to, people realize that primary care delivered via telemedicine is a better option than going to one doctor, then figuring out what to do next based on what the doctor says. So what we've done, and it's still early days for us. Again, it's a steep learning curve. We look at the patient journey from end to end, and it doesn't stop with the consultation. 60% of teleconsults, again, that percentage may change. It's driven by, maybe transient situations like the need for PCR testing. But in the past, I'd say 3-4 months, 60% roughly of teleconsults will require a follow-up procedure or medication. So you cannot end the telemedicine call just like that, because then you will have to put the patient in a position where they call for approval, or they figure out again, where do I get my lab test? Where do I get the medication? So what we're trialing right now is we are enabling the doctors to deliver care directly to the patient and to guide them through the healthcare network. So for example, if you need, let's say, a battery of blood tests, so the doctor is there to handhold the patient and to guide them to the nearest clinic or to offer them home care. We send a mobile van over to you, or we send a phlebotomist to your location, or we arrange for delivery of medication if you have an OP medication benefit covered by us. So I think that's really, we have to do better in that area. And when you look at the industry today, different telemedicine providers are approaching it different ways. Some people have one app where you can do teleconsult, then you can buy medicine in the same app after your teleconsult. Whereas maybe a payer like us, we since we cover even the tests, No, we don't even require you to seek an approval. We just give it to you. No, all in that one interaction. So I think that's another area for cooperation between India and the Philippines, and we can leverage our traditional strengths and existing areas of cooperation, move it laterally into healthcare, and scale up capability and capacity fast.
Of course, that also raises another issue. Of course, when talking about, we're talking also about giving them, or at least providing enough human resources when it comes to the medical sector. I would go back to Dr. Thakur this time around. That has been a long problem here in the Philippines. Of course, we have experienced an exodus also of healthcare professionals. Earlier, you were mentioning about providing centers of excellence at the same time helping the Philippines when it comes to capacity building. What are the concrete actions here that India and the Philippines can actually take part in order to encourage more professionals to actually service their fellow men?
Right. First is obviously the need to create a larger number of healthcare workforce, whether it's doctors, nurses, administrators, paramedical staff, etc. And for that, obviously, here in India, we've seen an expansion of the number of undergraduate and postgraduate medical seats that are being made available for more and more people to take up medicine as a profession. And we see a similar thing happening in the nursing field also. So that is on the capacity creation side. So you've got to enhance the number of resources that are available to create more doctors and nurses. And this is going to be a forward-looking agenda and a medium and long-term plan that needs to be put in place, both in India and as in the Philippines. As Mr. Rafael was mentioning earlier, we do have quite a number of similarities in the doctor-patient ratio and bed-patient ratio. So that situation is quite familiar and similar between the two countries. So capacity creation is going to be one, which is hard infrastructure along with good quality education. But the more immediate short to medium term horizon would need a lot of skilling, upskilling, retraining, and reskilling that would be required for the existing healthcare workforce that is there. So how can we upskill a ward nurse to become an ICU grade nurse so that when the need arises, he or she can actually move from the ward to take care of sicker patients? How can our doctors be upskilled to take care of more critical patients even as they train during their programs? How can paramedic staff be upskilled to become technicians? And that is where the opportunity exists for the results to be seen very quickly. And even that would take 12 to 36 months to show some signs of improvement on the ground. But it is possible. Through our Apollo Med Skills, we've been able to do that, where we've been skilling a larger number of workforce to move up the value chain of healthcare skills, as it were. And I think that is something similar that must be tried in the Philippines as well.
We would like to hear more from our panelists. Unfortunately, we have to move on to our next session. But then again, thank you very much again to our panel members. We have Dr. Karan Thakur, Mr. Vikram Bhupala, Mr. Christian Aragos, of course, and Mr. Rafael Resho. Thank you very much, gentlemen. Okay, now this time for our second panel session, we will discuss the opportunities for engagement between India and the Philippines, this time in the pharmaceutical industry. India is the third largest pharmaceuticals market globally by volume, with major segments including generic drugs, active pharmaceutical ingredient or API, over-the-counter drugs, vaccines, contract research and manufacturing, and biosimilars and biologics. India is also the largest provider of generic medicines, accounting for 20% of global generic drug exports by volume, with 500 plus APIs and 60,000 generic brands across 60 therapeutic categories. Meanwhile, the Philippines pharmaceutical sector is seen to get a boost from the increase in the demand for generic medicines. The major growth is expected among branded generics, while the overall generic medicine sector is expected to grow at a compound annual growth rate of 4.7% during the forecasting period of 2019 to 2025. The Philippines was also evaluated as the 11th most attractive market for the pharmaceutical companies and the third most attractive market among the ASEAN countries as of 2018. We are honored to have with us in this session, of course, respected experts from India and the Philippines. We start off with Mr. M.V. Ramana, CEO for Branded Markets at Dr. Reddy's Laboratories, a leading multinational pharmaceutical company based in India and overseas. In this role, he leads a multicultural team of more than 25 nationalities in over 25 countries and spearheads the company's foray into new markets across Asia, South America, and Africa. Please welcome Mr. Ramana.
Thank you so much for the introduction. A very good afternoon to His Excellency, the Ambassador of India to Philippines, and also to the Philippines Ambassador, to fellow panelists. Ladies and gentlemen, it's an honor for me to talk about Dr. Reddy's and the opportunities in pharmaceuticals. Dr. Reddy's is a leading Indian multinational established over the last 3 decades and has been in the forefront of how the pharmaceuticals have become a competitive advantage for India, both in India and outside of India as well. If you look into our journey, the reason why we started by our founding chairman, Dr. Anji Reddy, was to ensure that we provide affordable healthcare. Way back in 1980s, we were as a country supported by multinational companies. However, a large part of the Indian population were not able to get access to affordable medication, and that is the reason why Dr. Reddy started by getting into the active substances and then making them available at affordable prices, not only for our formulations, but for the other companies to formulate and provide. And this is something as a journey that we continued, not just in India, but in several markets, both emerging as well as the developed markets. So over the years, what we have continued to do, while we started off our journey to bring expensive medication within reach, we've also realized that the existing options to treat various diseases are not enough and not adequate. And that started our journey to get into basic research and try and solve problems in several disease areas. For example, in immuno-oncology, in psoriasis, by actually developing innovative assets, which are today in various phases of clinical trials. What we realize over the years that the patients are not just expecting a pill from pharmaceutical companies, but increasingly they are expecting their condition to be managed. And this is something which we find it our next opportunity to serve the patients and the consumers both in India and outside of India by providing the condition management support for various conditions that they go through, whether it is in the area of diabetes or hypertension or CKD and many other diseases. What we have realized over the years that we cannot work alone when we have such a large expectations both in India and outside of India, and hence we work with a large set of partners and try and bring them in a very collaborative manner to solve the need today that exists for both unmet and undermet needs. And while doing so, the critical element still would be to ensure that across the length and breadth of various countries that we operate in, we need to ensure the availability of our products so that as and when, whether the consumer is asking for it or the doctor is asking for it, we need to make the product available. We have consistently looked at how we are able to understand the unmet needs of our customers and dynamically deliver on it. So as an organization, we had today about $2.3 billion. This was for the last year. Obviously, this year we are growing well. We probably would be much bigger than the 2.3 billion as we close our financials in the month of March. But over these years, we've established ourselves through a direct presence in about 56 countries. A large number of colleagues across the world work with Dr. Reddy's. And as a company, we have been able to bring in newer medications, both into emerging markets and developed markets. And that is evidenced by the number of new product launches that we have, both in US, Europe, and in emerging markets. When COVID struck us, we were among the first pharmaceutical companies to respond and try to see how we would be able to bring in the medication. And as we started to understand the COVID better, today we are probably one of the pharmaceutical companies across the world that has a comprehensive portfolio, starting with asymptomatic to mild to moderate to severe to critical, and then continue to work with partners with even the vaccines that we've made available. And today we do have the ability to supply the vaccines globally to the other markets as well. Philippines as a pharmaceutical market is extremely important. I would want to thank His Excellency the Ambassador, who has facilitated our journey in Philippines. But for the authorities who are today present who are the policymakers, I do request them to consider for the benefit of the Philippines patients to see if the priority registrations can be accorded to two kinds of products. There could be today a lot of molecules which are not yet introduced into Philippines. Both Dr. Reddy's and several pharmaceutical companies from India have the ability to bring them, and they could obviously be a very important element in the treatment of that disease. So if priority recommendation could be accorded to the first time to the market pharmaceuticals, as well as the first time generics to Philippines. There are customs and the VAT duties which then get added on, which then many cases go as an out-of-pocket expense. Several countries around the world are reconsidering on these import duties. If there's opportunities to look at further reducing the burden for people who actually buy the product out of pocket. In terms of the patent timelines, there are certain elements of the patent where, as compared to some of the emerging markets, the patent timelines are longer. This then delays the opportunity to get the products into the market faster. If the authorities could look at any of these, I think both Dr. Reddy's and the Indian pharma companies could play our part, along with large Philippine pharmaceutical companies who are doing a great job in ensuring that affordable and effective medication is available to the large population of Philippines. So I just want to thank the organizers for giving me the opportunity to speak at this very august gathering. But I am absolutely sure, as the Ambassador Sir has mentioned, both the countries have great opportunity to collaborate and to serve each other over the next several decades. Thank you.
All right. Thank you very much, Mr. Ramana. We will hear more from him later in our panel discussion. This time, we head on over to our next speaker, Dr. Gerardo Legaspi, Director at the University of the Philippines, Philippine General Hospital. He is also the Chief of the Division of Neurosurgery of the UP-PGH Department of Neurosciences and a professorial chair lecturer at UP Manila. Please welcome Dr. Legaspi.
Good afternoon. Good afternoon, everyone. It's my pleasure to be here with you. Sorry, I'm in my working clothes. I'm in the hospital right now, and it's nice to see all of you once again. We missed the previous years because of the pandemic and the exchanges we've had in the past, and learning from them also as we moved on with operating our hospital and the healthcare system of the Philippines in general. I'd like to maybe share some experience of Philippine General Hospital, which involved dealing with the pharmaceutical companies locally and foreign owned during the pandemic, where it turned out to be a crucial part of the operations dealing with treatment of patients. I think at no point in my now 7 years as director of hospital has the availability of life-saving drugs has been more crucial than the last maybe the 2020 in 2020 and 2021, early 2021, or in the constantly evolving protocols for COVID-19 treatment have made a very confusing condition for us in handling our patients in the hospital. And it is only through access with the companies aggressively trying to bring the medications badly needed by the hospital as a counterpart of the innovator drugs, were we able to get ahead in delivering vital care to our patients. So I think the role of companies, generic companies, supporting, making available the drugs that we needed in comparison to innovator drugs really saved the day for us. Aside from the cost, of course, of the innovator drugs versus those made available by the generic companies that we've dealt with, have really made possible the availability, the accessibility of these drugs for our patients, especially in the Philippine General Hospital, where 98% of our admissions were charity patients. So I think the continuous partnership that we have with the different companies, our partners from in India and the rest of the South Asia distributors will flourish as we have experienced in the pandemic. And I think the challenge of ensuring the quality of these drugs, both established and the new ones, becomes even easier in the long run, because the track record shows that efficiency and efficacy are almost at par, are always at par with the innovator drugs. PGH spends around 1.5 billion pesos a year to buy medicines and medical supplies for our patients. I think during the pandemic we hit 2 billion because of the types of drugs that we had to buy for our patients. So we really look forward to partnerships with the companies that will make our money go a longer way while ensuring efficacy and safety for our patients. So I'm happy to be seeing a lot of our partners, the pharmaceutical company here this afternoon, and the government of India, always in support of the drive of PGH to always improve healthcare to our patients. So thank you very much for having me here. I'll be happy to join you in the question and answer portion. Thank you very much.
Thank you very much, Dr. Legaspi of UPPGH. At this time, let's proceed to Mr. Laksha Minarayana Neti, Chief Operating Officer for Operations Planning at India-based Biological E Limited. He has over 30 years of experience serving across multiple sectors, including healthcare services, pharmaceuticals and vaccines, consumer goods, and diagnostics. Let's all welcome Mr. Neti.
Thank you so much. Hope I'm audible. Very good morning to the delegates and the ambassadors of both countries. And it's such a wonderful opportunity to be speaking on this occasion. Many times we have these industry forums where we end up speaking, but now with the sponsorship of both the governments and then External Affairs Ministry and their ambassadors being on the August gathering, it shows the commitment from both of these countries to really make the bilateral trade to go to the next level. So it's a wonderful opportunity. I'll keep my comments brief, and then, as mentioned in the chat box, we will try and conserve some time for a Q&A later. So I represent Biologically Ill Limited. It is a company which has a rich legacy and heritage of about 70 years on presence. It has been the first Indian company in the biologic products to be incorporated, first pharmaceutical company incorporated in India, and also first anti-sera company to be incorporated in India. And thankfully, we are relevant and growing in all the three segments. We currently, we have vaccines is the large space that I look after, and so far as the presence, we already serve Philippines market in a significant way, both on the public and private markets. Public markets we serve directly to the national government through the ministries of health, and so also through the multilateral agencies such as UNICEF and other agencies. The three verticals that we are present in terms of the vaccines and the complex generics of injectables, and all of these facilities are audited by the US FDA, and then we have one standard policy of the product, whichever the parts of the world that it goes to. So on vaccines, we have almost about 8 products which are pre-qualified, and many of them are either currently marketed or they are in the stages of registration in the market. And we have a great experience of serving both channels in terms of the ministries of health and government supplies. And so also on the retail, we have very strong partners who are really helping us serve the population of Philippines. And we have tremendous growth plans for the country. And apart from Philippines and India, BE serves close to about 140 different countries, and annually we supply in the current year about 1.2 billion doses of vaccines across various different countries that I mentioned. And in all fairness, almost in India, at least one vaccine or the other for every child would have been from BE, and largely as called out by the moderator in the beginning, India supplies close to about 67% of the vaccines by volume in the world. So being one of those leading players in India, we also have a greater share of market access. And then we are very happy to serve Philippines as one of our important countries. And then there are great opportunities only to grow from here. I mean, that said, on the current commercial vaccines, we also are really happy to announce our Corbevax vaccine, which has got launched. And not just that, in terms of for the COVID vaccine, it's also been recently accorded the pediatric status, and then for children from 12 years and above, and we hope it will go up to 5 years in the next few weeks' time. So it's one of those opportunities that I really want. We will be working with our partners and also some of the government officials who are here. This is one place where India and through BE can be of some great service to the country there, because the particular product is one of the safest vaccines which is available in the market today among all the currently licensed vaccines. And the persistence data of this particular vaccine has shown the longest period of highest titers for a long period. More than 6 months we have had a chance to study, and it still holds up pretty strong. And we're also expecting, we're currently doing a very important heterologous booster for various other vaccines people have taken. And then as a booster, if we try and give it at the end of their 6-month cycle, how it looks like. And we're expecting the results to be pretty soon out. And I'm fairly sure in the space of Corbevax being one of the best vaccine that we have developed in collaboration with Baylor College of Medicine of Texas, is a great opportunity for strengthening our bilateral partnership in terms of serving health services to the Filipinian citizenry, both in the pediatric space and in the booster space, because that's the next, with so many waves going around the countries. We sense that Indian government is now recommending mostly the booster dose. Just in fact, that's the one of the best established um, um, outcomes that the Indian government has done is about in terms of the vaccinating people. And as a preventive step, it's possible that there could be a booster dose, and through that, the economic activity continuity can be continued. And then this is something that might be wanted to be considered in Philippines as well. And then we have an opportunity to serve this segment. That, I mean, we also have another division which supplies the complex injectables, which currently go to US and then Europe and Japan and other markets, which are also being served to Philippines. And then we have very interesting product pipeline like any other growing company has. And then we will continue to work with our partners and customers in ministry itself. But there are a couple of requests that I will have for the policymakers here. And currently, our Corbevax dossier is under review or whatever. Since this being an accelerated pathways that we were able to find in many different countries, especially in the backdrop of its pediatric and then the boosters availability, I just wanted to request if there is any other way of accelerating. I know there have been few vaccines which are already licensed in the country, but then it's I can guarantee our product stays on competition with some of the best in the world. Second is also one from a policy perspective. There is one process in the registration for every product that we do in terms of the site reviews. I mean, many countries, what we have is a site which is audited by a regulator. Once it is done, the product dossier, obviously, it needs a thorough review by the regulators. Obviously, it needs to go through. But one process in Philippines is bit something which I would request for a review is about for every product, the site review essentially happens even if it has already been approved for many other products which are currently being served. So the way that other countries do is site review, once it is done, it is approved, and it has its own validity, 3 years, 5 years, depending on the country. If that can be fixed, then the product by product you can keep adding, and then the regulatory review can that happen. But every time when you have another product to be registered and then again site being reviewed or whatever, I think it is something there is an opportunity for optimization, is what I thought. I'll bring it to the attention of the policymakers on this. And also from the supplies of vaccines into the country, and sometimes the way that it happens is, say, for example, much of our supplies are through the multilateral agencies like UNICEF and others. In terms of those are published prices, many times what happens is that the country governments take that reference and then try and ask for bids from various vendors, various manufacturers or whatever. But one of the things which is slightly off routine from many other countries that we serve is also that the budgets are fixed from the perspective of the price which is already listed by the UNICEF. UNICEF pays all the logistics and other things separately, but then in Philippines, everything is included. So in the net, one, the volume discounts and other things that we will try and give to UNICEF may not necessarily be possible because the budgets are already tightened to that extent. So one of the things that I would like to consider, obviously it is, we will talk to the relevant players, but sometimes, I mean, I'm not saying all the time, but sometimes we tend to feel that it's not possible for us to even bid, because we are one of the most competitive and affordable and accessible vaccines that we are able to supply to the globe, almost about 1 billion plus each year. Sometimes we tend to feel that it may not really meet our bare minimum cost covers, and then on top of it, the local VATs and taxes and other things, if those are already built into the budget prices and all, it is becoming a bit of difficulty. So it might be something that might opportunity for relook from a policymaker's perspective. So those are three that I thought I'll bring it to the attention. But otherwise, it's been wonderful experience serving the government of Philippines, which is large partner for us. And also we have very strong local distributors who are really helping us scale up pretty well. And with those, I would pause and then obviously be available for any Q&A towards the end. Thanks for the opportunity.
And I hope that's something we can discuss more of later. But this time, let's proceed to our fourth speaker, Mr. Higinio Porte, Senior Vice President and Chief Manufacturing Officer at Pascual Laboratories. He is also the President of the Philippine Pharmaceutical Manufacturers Association from 2014 up to present. Please welcome Mr. Porte.
Amazing afternoon, everyone. Allow me to share my slides. Okay, I'll be speaking about Philippine pharma industry and Pascual Laboratories, its size, capabilities, and opportunities. As president of the Philippine Pharmaceutical Manufacturers Association, allow me first to share with you the Philippine pharmaceutical industry. Currently, it is valued at 228 billion pesos, over above $4 billion. It is the third largest in the ASEAN region, next to Indonesia and Thailand. And in 2019, prior to the pandemic, it posted the second highest growth, second to Vietnam. Two-thirds of the pharmaceutical products being marketed here in the Philippines are from multinational companies, mostly imported. 68% are prescription drugs. In the last 5 years, the increase in importation outpaced the growth of the pharma market. About 98% of the raw materials are imported primarily from India and China. Now, let me share with you the capabilities of Philippine pharma industry. We are capable of research and development for natural and synthetic drugs. We can manufacture solids, liquids, semi-solid dosage forms, topical, dry powders, effervescents, parenterals, and injectables, except vaccines. We have world-class warehousing, logistics, and distribution facilities across the major centers of the country. We are capable of clinical bioequivalence testing. And with the current government, we have a very strong government and private partnership. Now, let me share with you the pharma market in the last 5 years. You can see that we've been growing consistently at above 6%. But in 2020, we declined by 4%, and we recovered in 2021 and of 2021 with 8% growth. 90% of the products can be accessed through the retail outlets and 10% in the hospitals. 68% is composed of ethical and 32% are OTCs. Now, let me share with you the top 5 categories in the Philippines. The first is, top of the list is with 27.7% share is on alimentary and metabolism. 16.5% cardiovascular system. Respiratory system drugs comprises 10.5%, and 9.1% is on systematic anti-infectives, and 8.9% is for nervous system. Now, these are the opportunities for growth and partnership. The Philippine pharmaceutical industry's growth is among the fastest in the world, 8 to 11% average in the next 5 years. The universal health care program by the government will give opportunity for local manufacturers and foreign traders to participate in the supply of pharmaceutical products through government bids. Prior to the implementation of the universal health care program, only about a third of the Filipinos have access to the right medicine. So with the implementation of the universal healthcare program, the government will supply the needed healthcare services to the especially to the poor member of the society. Thereby, there is an opportunity in the next 5 years to double the volume of medicine sales in the country. Faster growth among the middle income class, fourth in the world, next to China, India, and Indonesia. High GDP growth consistent, about 6% in the last 5 years prior to the pandemic, and we'll have a strong comeback in 2022 after suffering a negative 8% growth in 2020. Strengthening of collaboration between government and industry players. Opportunities for biotechnology and vaccine production locally. We just finished with a joint memorandum circular on the creation of Green Lane for the establishment of local vaccine manufacturing in the Philippines in terms of regulatory requirements and the support from the government. Local production of rigid and flexible packaging materials, crafting of the Philippine pharmaceutical industry roadmap, strengthening the local manufacturing capabilities. In the next 3 years, from the 32% share of the local manufacturer, our target is 40%. And in the next 7 years, 50%. And in the next 10 years, 60% of the medicine being marketed here in the Philippines should come from local manufacturer. Now, let me share with you about our company, Pascual Laboratories Incorporated. It was established in 1946 by two chemistry graduates from the University of the Philippines, isosceles in Leonora Pascual. Our first facility was established in Balotondo, Manila, and we transferred in 1970s to this current location in Balagtas, Bulacan. After several decades of growth, we became the third biggest Filipino-owned pharmaceutical company in the Philippines with the following number one products in the local market. In the natural cough remedy segment, Ascof Lagundi, and in the adult vitamin C segment, ascorbic acid potency. This is our capability. We are contract manufacturer and finished goods suppliers of pharmaceutical, herbal, OTCs, and dietary supplements in solid, both plain and coated tablets and capsules, and liquid solutions, syrups, and suspension dosage forms. We have certification, GMP certificate following the PICS guidelines, ISO 9001 2015 version, halal certificate. Our facility composed of production building, product development facility, quality control and microbiological laboratories, engineering utilities, warehouse, waste treatment plant. We have integrated our processes through SAP ERP system, and our service philosophy is Pascualab Malasakit, caring and being concerned with our family members and our consumers. Our biggest brands are Potency, Ascof, Cilium, Oracare, and Glutapos. And that's it. Thank you very much.
Thank you very much, Mr. Higinio Porte of Pascual Laboratories. Now we are going to proceed to our panel discussion. Again, reminding our guests, if you have any questions, don't hesitate to raise your hands. We are, of course, more than open to accommodating your questions. But this time, again, thank you very much to our guests. Let's proceed here. I'll kick things off with Dr. Legaspi. Dr. Legaspi, you mentioned earlier, of course, 2 years into the pandemic, you did mention that generic drugs, in a way, saved the day here for the country's local health sector here. But we are at a crucial juncture, like what some of our guests have mentioned earlier. Hopefully, we are already at the beginning of the end. Given that, which do you think are the products, medical products we are in most need of as we make that transition? And how do you see India, in a way, possibly supplying that gap as well?
Thank you very much. I think the the virus will stay, will be here with us for a while. It will not completely disappear until it becomes really endemic, as we all want it to be. So I think the antiviral drugs will still play a big role because we still have a sizable population of patients that are immunocompromised and elderly. So the antiviral drugs directed purpose for COVID will still be around. We have now another epidemic of hospital-acquired infection. I think the use of antibiotics during this COVID times has also in almost all centers has changed the biogram in most hospitals, and more and more we find ourselves needing the the wider spectrum antibiotics, and even those that are actually for compassionate use in some cases. So I think the antibiotics, the antivirals will stay with us for a while because of this pandemic. In terms of the local use, I mean, the more common uses, I think respiratory products in relation again to the viral infection for home care will still be a mainstay also in the needs for our patients on a daily basis. So the antivirals and the antibiotics will continue to be in demand, I think, at least for the rest of the year.
Dr. Legaspi, my bad, we still have one more speaker for this panel. We are going to proceed with our panel discussion later. But for now, let's welcome our fifth speaker, Mr. Christopher Bamba, Business Development Director of Lloyd Laboratories. He has 24 years of experience in business development, sales and marketing, commercial services, distribution, SAP, and sales operations in the pharmaceutical industry. Please welcome Mr. Bamba.
Hi, good afternoon. A pleasant afternoon to every participant of this conference. My salutations to His Excellency Ambassador Bagatsing and Ambassador Kumaran. Namaste and magandang hapon, sir. My appreciation to the organizers for the opportunity to participate in this event on cooperation between India and the Philippines on healthcare. The recent global events of geopolitical instability and the COVID-19 pandemic have brought many policy changes in the most aspects of societies. A more significant challenge is how to keep the possible impact of these instabilities on the economy at the bare minimum. In the healthcare sector, how to make essential medicines available to our kababayans during a pandemic. India has been throwing tremendous assistance to the Philippines towards self-sufficiency in the pharmaceutical industry. I was able to appreciate this early. It was when I was a medical rep somewhere in the north. I met a medical rep promoting a generic version of Comoxiclav. Then I asked, where is it from? Guess what? It's from India. No? Then I learned that the local company has acquired the technical know-how through a technical transfer from India. And a decade and a half later, I joined that company, and that company is Lloyd Laboratories. So we have been doing business with India for more than 30 years on API, or the active pharmaceutical ingredients. Lloyd Laboratories India was established about 15 years ago, and this is for the API trading, not just for the Philippine market, but for the countries where we operate, including Indonesia and Vietnam. Lloyd Laboratories also has a joint venture with Madras Pharma, a company in India. The company is called Sterile Gene Life Sciences. This is a 10-year-old company that is a green facility with EU and US FDA accreditations. Why India? India is one of the countries with most number of MBAs and PhDs. This is a fact. Everybody knows this. It is not really impossible that every street of major cities in India has a pharmaceutical manufacturing facility, and we wish to learn from this expertise. Why Philippines? As mentioned by Mr. Jun Porte earlier, We're the third largest market in the region. The sheer 110 million population needs access to affordable and quality medicines. Currently, we are doing a clinical trial for a candidate vaccine for COVID-19 through one of our affiliate marketing companies. And this is one of our capabilities. During the pandemic, one of the products that we were able to launch quickly in November 2021 is molnupiravir. It could have been earlier should the regulatory bodies was ready to accommodate the locally manufactured products for emergency use. The good news is the Philippines, if the Philippines will need more of these medicines in case of a surge, we will be able to manufacture it in our factory at Lloyd Laboratories. This is for our kababayans. This is a technical transfer from a fully integrated pharmaceutical company, of course, from India. So you see that Lloyd Laboratories has a long history of partnering with India, and we are continuing to partner with Indian companies. And as mentioned earlier, we are hungry to have partners on vaccines, not just COVID-19 vaccines, but other essential vaccines. And Lloyd Laboratories is capable of locally filling these products. We also need a lot of partnership with drugs in diabetes, cardiometabolic, and oncology, as mentioned earlier. So we are looking forward on seeing the Philippines as a self-sufficient country on pharmaceuticals with partnership and assistance of India. Thank you very much.
Thank you very much, Mr. Bamba of Lloyd Laboratories. Now, again, this time around, we are going to proceed to our panel discussion. I would like to this time ask Mr. Ramana. Earlier, we heard from Dr. Legaspi of UPPGH saying that, a number of the drugs that are here to stay, even as we continue our battle against COVID-19, you have respiratory products as well as antivirals and antibiotics. How well positioned is India to actually continuously supply the need for such products?
So I think pretty well positioned. I think both from all the medications that you need, whether it is a mild, moderate, or a severe case today, there have been protocols that have been established by WHO as well as the various independent countries. I think today there is good amount of capacity of the Indian pharmaceutical companies to supply the medication for all the three conditions. And of course, the capacity that India has now developed in the vaccines. So today, I think because of the capacity that have been
And that's it for today's video. Thank you for watching the part 2 of the campus tour here in MCA Manila. Thank you for watching the episode 2 of the School Bus. This has been Miss Hanan Kulyao and vlog dismissed. Kuya Joy, let's go. Watch out for part 3, episode 3.
Manufacturing hub here for pharmaceutical products in Southeast Asia. Mr. Neti?
Sorry, I didn't hear the question. There was a background noise. So can you just repeat the question?
No problem, sir. Again, do you see the Philippines as a possible manufacturing hub for India here in Southeast Asia?
Absolutely. We do this, in fact, but obviously there are great graduated ways that we will approach many countries for local vaccine manufacturing. And then for a size of Philippines, I think it genuinely makes both policy requests from the government, and so also it makes local consumption is also there. It's possible. But most of the countries, the way that we do is we approach this in 2-3 different tranches. In any case, finished product we are currently supplying, we could do that as a next step to do the local fill finish. But again, though, any time when we are, say, for example, our major customers currently are, say, UNICEF buys in bulk volumes about 40 million, 50 million of each of the product. So obviously the pricing would be in biotech products, the scale is everything from a cost and those perspective. So at that scale, we are able to give a much more competitive price. So especially when countries require local manufacturing, one of the policy enablers most of the countries will recognize at the outset, even at the policy level and our budgets level, is when you ask for smaller quantities, but it is for a sovereign requirement that you need to produce locally, the finances and other things will also be appropriately, because at a lower scale it will essentially be a little higher, maybe 15%, 20% higher in cost, because that gives the supply security and local availability. So to that extent one will be doing, and we have done this with many countries, and then we are also in discussion with few companies, but we will be very happy to assist in terms of making a local fill finish partnership. And then in the long term we can also backward integrate and then make it even the antigen there, because you have the right scale for the country.
Okay, Mr. Nettie, as a follow-up to that, earlier during your opening statement, you were mentioning some problems when it comes to access here, particularly in terms of regulation. What exactly are these challenges? And considering that the Philippines is at a crucial juncture wherein the elections will be held in a few months' time, what do you think are possible policy directions that the government has to adapt in order to make access for Indian pharmaceuticals to actually easily access the Philippines?
So a couple of them I will bring it to the conversation. One is about in terms of, I was mentioning for rest of the products we will talk about it, but the COVID vaccine that we have got it recently licensed, and there are a couple of specific clinicals which are underway, and our file will get submitted very soon, maybe in a week or this week or next week. So I was told that it will take about 2-3 months or so. If there are accelerated pathways that we can find, because that helps us based on India regulation. India has authorized emergency authorization for our product, and then obviously the WHO and other things will take its own due course. Parallelly, the countries, if mutually they can respect each other's regulators, and then if they can accelerate the pathway for approvals, that will help us to serve the market of Philippines. Specifically, we consider our product is extremely safe for the children up till 5, which is what will be authorized in India.
Okay,
among all the vaccines which are in the market. Yeah.
Okay, this time we proceed to Mr. Porte. Earlier, we heard Mr. Bamba from Lloyd Laboratories and how they have, at least over the years, partnered with India, especially when it comes to a tech transfer. Is Pascual Laboratories also exploring the same?
Yes, not just Pascual Laboratories, but most of the members of the Philippine Pharma Manufacturers Association, because it is very difficult and very costly to develop certain products. And what we can do is technology transfer. We can offer our capability in manufacturing. We have great scientists here in the Philippines, technical people. And currently, we have excess capacity for common generic products. But our focus now is on the development of a partnership in terms of technology transfer for a vaccine. Because with 110 million Filipinos going 120 million in the next 3 years, we have big size of the market, and currently all the vaccines that are needed by Filipinos are imported from other countries.
Okay,
I completely
given
agree.
that, I guess we can proceed to Mr. Ramana once again. Do we have him with us? Okay, Mr. Ramana, you did hear, of course, from Mr. Porte of Pascual Laboratory saying that tech transfer, especially in terms of vaccine manufacturing, is going to be very crucial. Just how well positioned is India to actually grab that opportunity?
So I think today the localization is something that many of the local governments are pursuing. So whether it is China, whether it is Russia, whether it is countries in North Africa, a lot of countries are insisting on localization of important pharmaceuticals in order to bring in self-sufficiency. And Indian companies and we as Dr. Reddy's have done a significant number of such projects, and many of them are complex in nature, including biosimilars. So if this is something that is in line with the expectations of the Philippines government, that here are the 100 or 200 molecules that we would want to localize in Philippines that would bring in self-sufficiency in critical medications. Absolutely, Dr. Reddy's or most of the Indian pharma companies would be able to do that. We have been able to do it even during the time of COVID, that we have been able to do the tech transfer even digitally because the travel to these countries was not possible. So I think it is an absolute possibility, and depending on whatever is important from the Philippines government based on the policy, I think Dr. Reddy's or any other company would be willing to support that.
Okay, now this time we proceed to Mr. Bamba. Earlier, you were mentioning again various partnerships with India over the years, especially with Lloyd Laboratories. This time, are you also looking at the possibility of introducing Philippine products to the Indian market?
Yes, to the other markets, not just India, but ASEAN market, we are already doing. We're doing export to Vietnam and Indonesia. And for India, I think there's just one product that we are doing export, and this is chocolate. And not coming from the Philippines, but coming from our partners in Indonesia and some in the Philippines as well.
Again, we are encouraging our guests here. If you have any questions, feel free, of course, to raise your hands, and we are more than willing to accommodate your questions. But I believe that's it for us this second session. Thank you very much again to all of our guests as we discussed the possible points for collaboration between the Philippines and India when it comes to pharmaceuticals. Thank you very much to Dr. Gerardo Legaspi, Mr. Lakshminarayana Neti, Mr. Higinio Porte, Mr. M.V. Ramana, and Mr. Christopher Bamba. Thank you very much, gentlemen. And now let us proceed to our final panel discussion session, which will focus on the medical devices sector. Now, Indian medtech was worth $10.36 billion in 2020, and that's expected to increase at a CAGR of 37% in 2020 to 2025 to reach $50 billion. Now, the market is categorized into the following four major segments: consumables and disposables, electronic equipment and surgical instruments, and implants and in vitro diagnostic devices. The medtech sector has helped enhance the quality of healthcare products and is able to provide real-time diagnosis, reduce healthcare costs, and give accurate data for further analysis. Now, during the COVID-19 crisis, the medtech segments witnessed a huge demand along with other segments in the healthcare industry. In the Philippines, private hospitals are proactive in searching for imaging and diagnostic equipment to accurately diagnose their patients, while public hospitals have delayed several intended procurements as they focus their efforts on addressing the pandemic situation. Local production of medical devices is limited to accessories, spare parts, and medical disposables such as surgical gloves, syringes, and needles. Now, the country's medical consumables market is expected to experience high growth in future as several local manufacturers are entering into the market with their latest product offerings. And we are honored to have with us in this session respected experts from India and the Philippines. Our first speaker is Mr. Rajiv Nath. He is the Managing Director at Hindustan Syringes and Medical Devices Limited, or HMD, a family corporation founded by his pharmacist father. HMD has created a niche for their disposable syringe called Dispovan, which is currently the most popular brand in syringe market in India. He's also the founder and forum coordinator of the Association of Indian Medical Device Industry, or AIMD, with over 350 members nationwide. Ladies and gentlemen, please welcome Mr. Nath.
Thanks a lot for this kind invitation to speak at your forum. I would like to share a presentation with you, which I will try to finish quickly. Is it visible to all? Yeah. Is it in the slideshow mode visible to you?
See your slides, sir.
Okay, thank you. So we do sincerely believe that medical devices is now the next big story in India after IT and pharma. And like the automobile industry has been doing good, and the other engineering industries like consumer electronics and mobile phones have not recently taken off. We think the next story is going to be medical devices as a takeoff stage. As many countries who were earlier depending upon China are looking at a cost-effective alternative. And India is known for its precision engineering and affordable engineering over here. So the medical devices typically are of 7 different categories. You've got consumables and disposables. You've got equipments and electronic and electrical equipments and software. You have instruments and implants and IVD reagents. In India, there were about 1,200 manufacturers prior to COVID, which have increased to nearly 1,800 post-COVID. At IMED, we are the National Association of Medical Devices, and we have a membership of more than 350 manufacturers and more than 200 associate members in the country. We've been working very closely with the government on various policy issues and COVID-related issues. So these are some of the leading manufacturers in India for medical devices amongst the various categories. In disposables is my own company, HMD, which is the leading manufacturer with a turnover of about $90 million and also exporting for many years to Philippines. We also have medical electrodes to make electrodes for ECG, Carnam Latex, which is the leading manufacturer in India for surgical gloves. G Surgiware is one of the largest manufacturers in the world for making shunts. MRK is also one of the leading manufacturer for surgical gloves. In the consumables category, we've got a company called Romsons, which is very strong in the plastic consumables category, IV sets and infusion sets, etc. Similarly is Polymedicure. And another company to watch out for is Healthium, which is a leading manufacturer for making sutures and suture needles. BR Life Sciences is also strong in the cardiac consumables healthcare space. And Tyner Orthotics, which is based in North India, Chandigarh. This is very strong in the rehabilitation and the orthopedic assist devices consumables. In medical electronics, these are the leading manufacturers over here. Trivitron, Ellingers are very strong in the X-ray segment. We have BPL, and Mr. Nagpal is going to be speaking after me. And he'll also be talking about his company and what they do in Philippines. Another famous company is Scanray, which became more popular in the Indian public as the leading manufacturer supplier for ventilators, which were in great demand for COVID. And then we also have ITPL. This is a leading manufacturer for the operation theater equipment and the specialized equipment used in surgeries. In the equipment category, we've got Mitmark, which is a French company which makes hospital beds in Bombay. We have Remy, which is very strong in the blood transfusion and storage equipment. There's a company, Cura, which was basically for selling the refurbished equipment and then ventured into making medical electronics. And then Shivani and Phoenix making incubators and other electronic equipment. In implants, there are various kinds of implants. So the cardiac category has got 3 major manufacturers. The foremost 2 amongst them are SMT and Merrill in Western India. Then we've got intraocular implants. Again, India is the top 10 in the world to make intraocular implants. And the leading companies are from Chennai area in South India, which are Apaswamy and Orolab. And in the case of orthopedic implants, the leading manufacturers are Biorad, which makes knee and hip implants, and Pitkar, which is very strong in the trauma segment. Then in diagnostic segments, we have Transition, Trivitron once again over here in both the equipment category as well as in the reagents category, and also Merrill and Agape similarly, and Mitra Industries. In the instrumentation category for surgical instrumentation, you have ASCO in Delhi area. You've got Allen Electronics, which makes electrical cautery equipment for surgery. You've again got HMD, my company, which is making surgical blades, and Quality Needles that makes suture needles, and Endomet Technologies that makes endoscopes. Just to give you a flavor, I've given these names to you so that should any of the importers in Philippines be wanting to know who are the leading companies in India with reputation, you can reach out to us and contact any of these companies. So India has been now, I would say, growing more rapidly in terms of the export business. From 2015 at a turnover of about $1.9 billion. Last year, the exports have grown to more than $2.5 billion. The growth rate is a steady growth rate of 10 to 15% year on year, compounded every year. COVID was a problem area for many of the businesses worldwide, including India. Many businesses had to shut down or they were slowed down. But medical devices was one of the silver linings, I would say, where there was a high influx of new manufacturers into the arena over here. So the sky blue is what was the number of manufacturers in these various COVID critical medical devices, you can see. And during the last 2 years, you can see a huge rush and impetus of manufacturers who ventured to contribute to take up the fight against COVID, and they volunteered to put up factories to make PPE, coveralls and gowns, making more gloves, making more ventilators, making sanitizers, goggles for the kids, masks with the mask of the N95 type or the surgical disposable type. Simple things like a swab for the testing for COVID. And you can see RNA extraction kits and the diagnostic kits. For this, there were no real manufacturers, but yes, we had more than 150 manufacturers in the IVD line who were kind enough to add this to their product line and diversify very rapidly into making this kind of products. So very rapidly, India saw within a few months' time huge gains in capacity because of the, I would say, very capable engineering capacities and capabilities in India. And with excellent coordination and teamwork with the various government departments, academic institutions, scientific institutions, manufacturing could take place and could be ramped up. When the supply chains were disrupted between April and between March and June of 2020. From HMD, we are very strong in the drug delivery space. We manufacture disposable syringes from 1 ml to 50 ml, which we supply to Philippines, and also insulin syringes and insulin pen needles for diabetics. We are also the largest manufacturer in the world to make auto-disable reuse prevention syringes for curative injections, and also the largest manufacturers in the world to make auto-disable syringes for the vaccination delivery, which was very critical for COVID. And we are one of the leading suppliers of IV cannulas, which we supply to the Philippine market through our channel partners, Medical Center Trading, which is an associate company of Maguri Drugstores in Philippines. So currently our manufacturing capacity is about 1.2 billion auto-disable syringes, which per annum, which we are taking that to 1.5 billion auto-disable syringes per annum by next quarter. And we hope that in the next 6 months' time, COVID can be stalled worldwide with more than 80% of the world being vaccinated from the current 55-60% that has been achieved. We are supplying to Philippines not only via Medical Center Trading Company, but also via UNICEF, which is for which we are probably the largest suppliers for auto disable syringes in the world. And more recently, we have also supplied to Philippines the 0.3 ml auto disable syringes. And next year, hopefully we'll be supplying for the children vaccination for the Pfizer, the 0.2 ml auto disable syringes, which is currently undergoing WHO pre-qualification. So in India, medical device industry has been quite limited over the years. But yes, we can see that there has been a good amount of import and export that has been taking place between India and Philippines. Last year's imports from Philippines were $14 million. Year before last was $14 billion, which went up to $19 billion. And mainly they were spectacle glasses, hearing aids like cochlear implants, and surgical instrumentation like skin staplers. On the other hand, India exports nearly an equivalent number of medical devices into Philippines. The imports are of a similar $16 million per annum capability. But because of COVID, this went down slightly to $14 million last year. The main products which are coming into Philippines from India are IV cannulas and drug delivery infusion sets, surgical instrumentation, intraocular lens, X-ray machines, and the automatic clinical analyzers. So, like it has just been mentioned, we are aiming for India to be one of the top 5 manufacturing hubs in the world for medical devices. Currently, it's the 4th largest market for medical devices in Asia. And recently, we've seen that there have been a lot of Make in India achievements, like I mentioned to you, which got accelerated even in COVID times. So over the last 5 years, with the initiatives taken by the government, the Institute for Healthcare Technologies, the Kalam Institute, was established at Visakhapatnam in South India, which is to promote indigenous technologies. The Department of Biotechnology has put up various venture centers, CCAMP, IKP Knowledge Park, Medi Valley, and Bio Valley in Andhra Medtech Zone. And these assist entrepreneurs in taking out and startups in taking out medical devices which can be useful and affordable to the medical community. To assure quality, the Quality Council of India came out with the ICMed Indian Certification for Medical Devices. And the Government of India has come out with regulations for medical device rules in 2017, which is undergoing a transition. And by October of this year, the low-risk medical devices, Class A and B, will be fully licensed. And by October next year, the medium and high-risk devices, Class C and Class D devices, will be fully licensed. We also have regulations in India for certain categories of medical devices like stents and knee implants to assure affordability. And this is something that even Philippines can consider going forward to learn from India. To assure that India moves from unorganized clusters to more organized clusters, the unorganized clusters are currently in the Delhi NCR belt, the Bombay Ahmedabad belt, the Bangalore area, the Bombay Pune belt, and some in the Chennai area. But now structured medtech parks as clusters are coming up in Visakhapatnam and Hyderabad, and also shortly in 4 other states by the next year. Additionally, the government, Quality Council of India, along with IMED, our Association of Indian Medical Device Industry, and the Andhra Medtech Zone, established the Indian Biomedical Skills Development Council, which started as a consortium. And this assures training and certification for the engineers which are required for maintenance and upkeep of medical equipment in India as well as outside of India. The government has also introduced recently a production-linked incentive scheme and a medtech park scheme to take forward the acceleration of Make in India for medical devices. So under this program, what we are targeting, and IMED is assisting the government, is to tap the $15 billion market, which is currently 80% import dependent. Nearly $6 billion of imports take place. We are seeking $10 billion in terms of investment opportunity over here. And if there are medical device manufacturers in Philippines who want to reach out to India and to have manufacturing in India, this is something that you can explore with Indian partners over here. Whether in terms of collaboration, where we are targeting 1,200 collaborations of say $5 million each, and 200 joint ventures, say of about $10 million size each. And we are also seeking the large MNCs, nearly 50 of them, to invest about $100 million each over the next 5 years into India. So in India, the Make in India for safety regulations is what we have done are currently under the Drug Act. But like in the developed world, like in Canada and other countries, a separate act is in drafting to regulate medical devices separate from pharmaceuticals. The rules are separate already. In terms of ease of doing business with Philippines, I have been myself to Philippines a number of times. I had very good interactions with various hospitals and users of our medical devices. We enjoy working with our long-term partners, Medical Center Trading, and they are very competent and adept in getting our products registered in Philippines. What we seek from Philippines is even though the registration process is quite quick compared to many other countries, usually an importer can get the registration done in 2 to 3 months' time. However, we think that there can be a mutual recognition agreement between the Indian government and the Philippines government, whereby manufacturers who've got an Indian certification for medical devices, or they got a CE mark, or they have the certificate which is called the Medical Device Single Audit Plan certification, which is the high certificate internationally for medical devices. This can be used to demonstrate competency of Indian manufacturers and can be used to fast track their registration process. Currently, there are no restrictions for sending samples for registration purpose from India to Philippines. But before a manufacturer like us enters the market of Philippines, one would like to send samples across to potential distributors and channel partners. And here we need to do that before we go in for registration. So while there is no restriction to send samples to the authorities in Philippines for registration, we request that they should also be allowed a permission to give a small quantity of samples to help evaluate or to have a feel of the product quality coming in from India by the commercial distributors over there. We also seek that by this mutual recognition agreement, there could be an MOU whereby the registration costs could possibly be lowered for Indian companies who are coming into Philippines, especially for the second round of registration, where repeat products are being added upon. So we look forward to working in Philippines in partnership, and I can tell other Indian entrepreneurs who want to explore the Philippine market. The business is very healthy, very fair business terms, very prompt communication. English is well spoken, and communication is not a problem. And if anybody has any requests, you can talk to us at IMED. You can reach out to me at this email ID, whether you are wanting to import medical devices into India or you are looking for collaborators or joint venture partners in India. Thank you very much.
All right, again, thank you very much, Mr. Rajiv Nath from the Hindustan Syringes and Medical Devices Limited, or HMD. This time, let's proceed to our second speaker, Mr. Kristen Yang. He's the Managing Director and President over at Terumo Marketing Philippines. He is a medical technology business leader with a passion in driving purpose-driven innovation for exponential transformation in healthcare standards and systems, driving impact in patient care and outcomes. Again, let us all welcome Mr. Kristen Yang.
Well, good day, good afternoon to everyone, to Your Excellency, and ambassadors from both countries. Namaste, magandang hapon. So I'm Kristen, and today I'm representing Terumo. So Terumo, we are actually a Japanese corporation, and we are manufacturing like syringes, blood bags, pumps, kits. We also do things like blood pressure monitors, thermometers, and we are also in the cardiac space, both in the cardiac surgery side on heart lung machines, as well as the intervention access devices. So within APAC, actually, we are in most of the markets, including both and India. From a manufacturing perspective, we have the manufacturing plant in Laguna, and we manufacture about 3,000 employees in the manufacturing plant. Export to over 70 countries from that plant itself. I'm sorry. Is this a little bit clearer? Okay. So we export to over 70 countries from the manufacturing plant from Laguna in the Philippines. And currently, we also do have manufacturing sites in Costa Rica, in Japan, within the Asia Pacific region. I think we have some manufacturing partners in Vietnam, in China. But I believe that we have not really had a lot of inroads from manufacturing partners in India at this point. So I'm going to speak on behalf of the medical devices sector, beyond just to today. Right? That the medical devices market in the Philippines is actually a rapidly growing market. If we look at the healthcare sector across both countries today, we draw a lot of similarities in terms of both a very heterogeneous market, issues in terms of accessibility to healthcare, affordability, and also I think from a price control as well as access to devices standpoint, both markets are fairly heavily reliant on the more sophisticated devices. So if we talk about manufacturing standpoint, I think we do have local manufacturers for medical supplies, some of the simpler devices and medical basic supplies such as gloves, such as masks, but we are talking about heavy equipment, high-tech equipment. I think that's something which is still highly dependent on exports. So as Philippines is approaching and trying to roll out the Universal Healthcare Act, accessibility to healthcare services is not just the only thing, but also accessibility to healthcare products, including both pharmaceutical and devices. And at the same time, I believe that a couple of years back, we started with the MDRP for the pharmaceutical side to start to look at standardization of pharmaceutical drugs. And that is something which we do expect that in time, we are looking at better definition of value of medical devices across some of the categories as well. We have already started looking at a new aid administrative order coming up from the Department of Health, starting with the price essential medical device list, and that is where we are looking at regulating and giving price guidance on some of the COVID-related products. I think that was something that we will look at. There was also an acceleration on the emergency usage approval for devices that are COVID-related, and that really shortened a lot of approval timelines, even though I think that is still something that we can look across more situations beyond just COVID-19. So there has been a realization, I think, over the past 2 years with COVID-19, and in fact, even moving forward as well, that as we start looking at a supply chain and stability of medical devices, we have to be more reliant, self-reliant within our own region. If we look at the demand of ventilators, we look at the demand of syringes, there has been a spike in demand, and yet despite having a manufacturing plant in the backyard of our own country, there has still been a shortage of syringes supply into the country, and I think that there is a lot of opportunity that how we can collaborate across the region. As we start looking at manufacturing partners in China, even as we are speaking today, there are risks in terms of disruption in the supply chain. So quite well. So with regards to medical devices, I think that we definitely should explore more opportunities within the countries. But one call-out which I would request for maybe just to look at is really the import taxes of medical devices across the Philippines. In the Philippines, our import tax today is 2%, while in India, I think we are 7.5%, probably increasing to about 5%. And that is something which we are watching very closely. That will definitely impact and collaboration of possible countries.
Kristen Yang. I do hope, of course, that we can at least improve or fix our audio for the panel discussion later with Mr. Yang. But this time, let's proceed to our third speaker, Mr. Praveen Nagpal. He is a Chief Operating Officer at BPL Medical Technologies for its global operations based at Bangalore, India, with 25 years of healthcare experience. He previously worked at Nielsen Market Research as Executive Director responsible for the operation of for operations in 25 countries and has held leadership positions with GE Healthcare in India. Please welcome Mr. Nagpal.
Thank you so much for this eminent introduction. I must thank His Excellency Ramon, His Excellency Shambhu for setting up this India-Philippines business conference on medical devices as well as healthcare. I think this is also possible with efforts of FICCI, Business World, EEPC, as well as all other eminent participants and speakers. I must thank Rajiv ji and Christian for setting the context on the medical devices from India and from Philippines. Just to give a brief, what I represent is a BPL Medical, which is established since 1963 in India, and the medical business out of our parent company started in 1967. So this has been more than 55 years as a company, and with recent investments about a decade back has fast-tracked the growth of this organization. We are present into various product categories as a segment. We are into diagnostic cardiology. We are into critical care segment. We are into women and child health. Imaging is a big portfolio for us, and good investments has gone in this. Home care is another segment which we felt is important for any healthcare device provider looking at infrastructure required to provide health over next many years. And we also deal with some adjacent consumable and accessories to our products, and apart from there which touch the same customers. We deal with the products like ECG, defibrillator, C-arms, anesthesia machines, patient monitoring, maternal and infant products like warmers, incubators, some women and health child products like fetal Doppler, fetal monitor, colposcopes. In imaging, we deal with X-rays, C-arms, and ultrasound primarily. And home health includes wellness products, pain management, respiratory products, etc. So these are our various products that we provide under these segments. Our headquarters is in Bangalore, which is in Karnataka, a part of India. And our factory is in Kerala state, which is south of India. And this production facility is there since last 50 years. We are an ISO 13485 company and have most of our products C certified. Based on distribution, we do a large distribution directly and indirectly in India through our direct team and distributors. And we also do distribution in many countries across the world, which we have set up in last 4 to 5 years, mainly through our distributors. Our marquee clients are all segments, which are government, which are private hospitals, clinics, basically all segments of hospitals which we deal with. Many awards and recognitions, which are definitely required for a growing organization to see that what we are doing are also getting reciprocated from the market. So that's a strong position organization in terms of providing products from diagnostics to treatment under medical electronics. Recently, in last 5 to 7 years, we have come up with many products on ECG, defibrillator, patient monitor, X-ray, C-arms, home care products, and this journey is going on. We have come across with more than 25 products. We are doing about $100 million business from BPL Medical. At the same time, from Philippines, we have an humble start of about $200,000 business, which is just happened especially from last 1 year or so. So if I understand right, the partnership with Philippines can be on many facets, but to understand what's happening and what we need to look, we do understand that Philippines is a large country with about 12 million population, with more than 7,500 islands across. And this makes the delivery of healthcare complex as well as very important when we have the population residing in so many islands across the country. Now, we also understand that cardiovascular deaths are high, which is a very significant percent in adult deaths. Critical care and respiratory challenges are there. The country has also very high maternal and newborn mortality rate, which is also linked with high fertility rate, and we have to deal with these issues across country. Now, what BPL can do in such case is see that how we go over and above a partnership of just buy and sell, and we see that how we can provide a strong collaboration beyond purchase and sale. Now, if we have understood the problem statement correctly, I think we are rightly poised with our various verticals of products what we offer, and not only us, many other medical device companies, which Rajiv ji has shown briefly, are capable of having many such collaborations where we are focusing on medical device segment. Our products are strong. Why BPL can play a major role is that the value which it can create through these products is superb. It has a very high quality products which are certified at various levels in India and with outside agencies, and we have, as I said, many products are CE certified. This comes at a right value, which is as we have heard initially, with the right democracy and the demand, this can be positioned very well in the growing demand of hospitals which are coming up fast in Philippines. This can fulfill the demand of healthcare, provide basic needs to the patients, and see that products like ECG, defibrillators, monitors, which are very fundamental to any diagnosis and then any treatment, are available at large. Now, this also comes how can we proceed on this? Now, this we can do with strong technology collaborations as an Indian organization. If we can have certain organizations from Philippines who have wanted to come forward and do a business based on either taking the units in SKD formats or having some kind of a technological collaboration, that's most welcome. I give you an example. We have recently made during COVID oxygen generators, and our technology we offered to one of our Government of India public sector units, Bharat Electronics, and they have made more than 15,000 oxygen generators during the need of COVID, and they are counting further and supplying across the country, and they have plans to even go outside country. The technology is ours, and they have used this technology to position these products through their large manufacturing setup, which even does manufacturing for defense, etc. So they have come forward, taken our manufacturing license, and helping the country at need. And I think such kind of partnerships are most welcome when we are talking about just buy and sell collaboration. This also needs to be thought that when we are talking about certain products in India or at Philippines, there is a huge requirement of skills, and this skill enhancement seems to be very much possible in collaboration between organizations, because Philippines is a very highly educated country. We have common languages, the understanding could be fast, the online and offline training programs can be run across, We can pick it up in what sector, whether in regulatory or whether in product or in electronics or in distribution, where we need to enhance the skills. I think that's very much possible. And such kind of partnerships are also welcome, because when you are growing up, skill should not become a bottleneck in the growth of both the organizations or both the countries. As I said in the beginning, that we have to manage 7,500 plus islands in the country. It is important that we talk about digital health. Now, why digital health? Because the data has to move from various islands to probably a command central or central stations where patients should be given the data should be read and given an understanding of what's their diagnosis is and what treatment should follow. Now, digital health also has a major role to play with the products, and I always talk about that this digital health on the products, we call it connected health, and this connected health can be either directly through the product, through various options which are available, which are standards across the world, and interoperability should be possible through these communication. As well as there should be software tools which take all this information, present it in a right format to the clinician, which while managing such a large territory will always be stressed. So we can come forward with our solutions on that along with the medical devices, which again, like patient monitors or ECGs or any home care devices, possible to come up and work towards that. One last thing on the devices side, when we are talking about managing such a large facet of healthcare, it is important that we talk about home health. Many of our requirements should get fulfilled at the homes itself, because the hospitals can fulfill a requirement for the patients which are going there. But when propensity to pay increases as it is increasing in Philippines, it is important that we start providing this basic healthcare at the level of home. So we need to pick up certain devices which Philippines can, distributors or sellers or hospitals can guide their patients to use at home, so that the stress on the hospitals is limited. I think this is an important parameter and factor which can also decide which way we can have certain products which can be used by the patients at home. And BPL can again play a major role in this. Looking at all these solutions, I think we are well poised to do more business with Philippines. We are also welcoming any partnership which can happen in India from Philippines, and look forward for mutual benefit. Thank you.
Okay, definitely. We still have more room for technical collaborations there. Thank you very much for your time, Mr. Praveen Nagpal. And lastly, our fourth speaker for this session is Mr. Bhargav Sosale. He is a Vice President of Software at India-based Remedio Innovative Solutions. That's a company that builds the next generation of smart medical devices to improve eye care access in the world. In this role, he helps establish a software culture in an otherwise hardware-focused company, as he puts it. Please welcome Mr. Sosale.
Hi, good afternoon, everyone. Good afternoon, dear ambassadors, the audience, the organizers, fellow speakers. Thank you so much for a wonderful session so far. I'd like to begin by sharing my screen. Hopefully everyone is able to see my screen. So on the photo here is a man named Rohan. And Rohan has had type 2 diabetes for about 10 years. So one day, Rohan goes to his doctor and gets the regular diabetes checkup. The doctor says, Rohan, you've had diabetes for 10 years and diabetes can cause blindness. So please go to the eye doctor and get your eyes checked. But Rohan thinks to himself, oh, I have to get another appointment for a separate doctor. I have to travel many, many hours in traffic. and the eye doctor is going to put drops and dilate my eyes. My eyes seem fine, my vision is normal, why should I go? Sorry, something's... At first, his eyes were fine. That was his photo of the retina, and there were no symptoms, there was no damage to the eye. Slowly, the eye actually started getting damaged. However, there were still no symptoms. Then the eyes got even further damaged, and yet there were still no symptoms, and Rohan did not go to the eye doctor. But the next day, Rohan woke up and there was sudden and complete vision loss. At this point, Rohan rushes back and goes back to his diabetes doctor. And the doctor says, it is too late now. You should have gotten your eyes checked when you were previously referred. Just like Rohan, 2.2 billion people around the world suffer from vision impairment or blindness. This is due to many diseases such as diabetic retinopathy, AMD, cataract, glaucoma, and refractive errors. 50% of patients do not even know they're at risk, and 80% of it is actually completely preventable. And this has a very high amount of global economic costs. Bringing this to the context of India and the Philippines, in India alone, there are 300 million people at risk of blindness due to these diseases. In the Philippines, there are over 20 million people. The problem is because eye care does not scale. One of the bigger problems with this is that there is an insufficient doctor-to-patient ratio. In India and the Philippines, and for most of Asia, there is only one eye specialist for every 100,000 patients. Secondly, the medical devices today used in eye care are very inadequate. They're extremely expensive, they're bulky, they're non-portable, and they're very difficult to use. They actually need a specialist trained in using those devices to use those devices. And eye care is also very inconvenient and time-consuming. It's very difficult to get appointments, there are very slow turnaround times, and it's overall inconvenient. What does this mean? This means for patients, they don't have access to proper eye care, right? It's difficult and inconvenient. And for doctors and healthcare providers, it's difficult to hire eye specialists and provide full eye care. We at Remedio, we remove the fundamental barriers to eye care by allowing anyone to conduct an eye exam. Our devices do not require any eye care specialist. There are no infrastructure requirements required for these devices, and they are completely lightweight and portable. They also have embedded algorithms to automatically detect and screen for the common eye diseases that I mentioned earlier. We remove all barriers to conducting an eye exam. It takes less than 5 minutes to screen a patient's eye, and it can be done by anyone, anywhere, at any time. Going a bit deeper into this, when I say there are no infrastructure requirements needed, that is because our device is battery powered and it works offline. So you don't need electricity, internet, or even space. It is very handheld and lightweight. It does not require an eye specialist. Anyone can use this. It does not require any training at all. And it automatically also can give you a diagnosis. It is also lightweight and portable. Our devices are being used, in home-based screening programs where people go door to door. They're being taken to rural areas. In the context of a country like the Philippines, they can actually also be taken very easily across a different group of islands. And our device has a very smooth user experience, which has both hardware and AI. And this allows us to provide a much better product experience for the user to screen for eye care. Our solutions actually benefit more than just the patient. By allowing any healthcare provider to do an eye test, they can now offer this test as a service and increase their revenue. By screening more patients, we're actually helping detect more people in need of treatment and surgery, and also helping ophthalmologists and larger hospitals increase their revenue. By doing so, we're also preventing blindness and hence reducing the economic burden of blindness. And in many parts of the world where we do not have equitable access to eye care, we can improve healthcare equity and reduce healthcare inequality. Of course, we do this across the entire eye care spectrum. We have devices that can screen the back of the eye, the front of the eye, screen for refractive errors, as well as the visual field. We also have devices that can actually do all of this in one. And as mentioned, we have AI products to help you detect diabetic retinopathy, glaucoma, and AMD. One disclaimer, the AMD is in late stage development and will only be out later this year, but diabetic retinopathy and glaucoma are currently live. Now, our devices have actually been extremely published about and validated in many clinical journals. On the hardware side, our device has been compared to the gold standard imaging systems made by companies such as Topcon and Zeiss, and we have demonstrated equivalence to those devices. On the AI side, we have actually demonstrated sensitivities of between 93% to 100% for diabetic retinopathy in many different studies. And these have actually been published in the most prestigious clinical journals, such as JAMA, which is the Journal of the American Medical Association, the British Medical Journal, Nature, and also in India, the Indian Journal of Ophthalmology. We are a fairly mature company and we have been in the market for a few years. So far today, we have actually impacted over 10 million patients, have sold over 3,000 devices in 20 different countries, and have 15 over peer-reviewed publications. Our biggest customers, or our flagship customers, are in India. We have the governments of Kerala and Tamil Nadu using our devices for their healthcare screening programs in those particular states. We also have prestigious institutions such as Dr. Mohan's Diabetes Specialty Center or Aravind Eye Institute using our devices. In the West, in the US, we actually have cases like Walmart using our devices to screen people who go shopping at Walmarts. And there are over 100 Walmarts that are using the device. We also have the University of Virginia using our devices to screen for eye disease across Virginia state. So I'd like to end with a quick demo of a video video of our device in action. This is how it works, and this is a real-time eye exam. As you can see, we've got the device capturing someone's eye. It's an iPhone application attached to the device, so everything looks like an iPhone app. We have an AI that can automatically scan for the eye, as is happening over here. Once everything is in view, the AI will automatically trigger a capture. Once a sufficient image is captured, it can be analyzed alongside other images previously captured, and you can run it for glaucoma analysis or diabetic retinopathy. And this is what this looks like. Please keep in mind, all of this is real time. None of this has been sped up or anything. And you can see a PDF report has been generated. Similarly, we can do this for glaucoma as well. So the entire process of imaging takes maybe 5 seconds to 10 seconds per eye, maybe 2-3 minutes for the entire patient, and another 10 seconds to generate a PDF report. This can then be sent directly to the patient or printed out and given to them. Thank you so much, and I'm happy to answer any questions during the panel discussion. Well, just one last thing. I can't show the device because of my background, but I have it in my hand over here, and it's very lightweight. It's only 1 kg and uses an iPhone. I think the background seems to be blurring it out, so yeah.
We weren't able to see the product, but definitely some innovative products there, Mr. Sosale. We would like to hear more from you as we start our panel discussion. But this time, let's start with Mr. Kristen Yang. Mr. Yang, good afternoon. Just checking if you can hear us.
Yes, I can hear you loud and clear. Can you guys hear me?
All right, yes. Very well, of course. This time, what lacks in the medical devices supply have you been seeing in the Philippines, and how can our partners from India meet such demands?
Well, I think that there has been a lot of, during the case of COVID-19, there has been a sudden surge for COVID-19 care related products, right? And some of these products include things like oxygenators, ventilators, and in the more recent time, as we are actually embarking on the vaccination program, syringes. So as we start depending on really international supply, where we are looking at major players such as Medtronic, Becton Dickinson, the US-based suppliers and manufacturers, they also have their own demand when you look at the COVID-19 cases surge in the US and the European markets. So when we look at the allocation of products and inventory into our region, when we do have a surge in our cases as well, there has been a global crunch on supply. And definitely, I think that is a lesson learned, that as we start looking at centralizing manufacturing and supply chain, we do have to have a more distributed way of and more equitable way of allocating inventory. And definitely that is both a market opportunity, but also a lesson in terms of how we really plan our global supply as well as demand.
All right. Thank you very much for that, Mr. Yang. Now, let's proceed to Mr. Sosale. Earlier, you presented quite interesting products there from Remedial Innovative Solutions. Are there now plans to at least enter the Philippine market?
Thank you so much. That's actually a very good question. At the moment, we are currently doing a pilot study with QualiMed, and this is actually happening at the QualiMed Center at Bulacan. And they're doing a pilot study to assess the feasibility of our device in their clinics. If this goes well, we plan to, expand across various other QualiMed centers and then enter the Philippines.
Do you have a specific time frame for that, sir?
At this moment, we do not have a time frame, but if anyone and any participant is interested, we are actually happy to collaborate on opportunities.
All right, thank you very much for that, Mr. Sosale. As much as we want to ask more questions to our panel members, we have to wrap up this session. But again, thank you very much to Mr. Kristen Yang, Mr. Sosale, Mr. Nagpal, and of course, to our first speaker for the panel. I'm referring, of course, to Mr. Rajiv Nath. Thank you very much for giving us your insights as to how India and the Philippines can further collaborate to enhance, of course, the medical devices industry. Thank you very much, gentlemen.
Thank you so
much. Now, of course,
Thank
what an insightful series of panel discussions. To formally close our program, I'd like to first welcome Mr. C. Raja Sekar, OSD, Ministry of External Affairs, Government of India, for his closing remarks.
Good afternoon. Am I audible?
Yeah.
Hello. Yeah. Thank you very much. Ambassador, His Excellency Ramon of the Philippines, His Excellency Shambhu Kumaran, Indian Ambassador to Manila, and distinguished participants from business from both the sides, eminent persons, ladies and gentlemen. First of all, I would like to heartily congratulate you all for putting together this fruitful, pleasant, productive event. As they say, when the going gets tough, the tough get going. COVID was a crisis, but you have innovatively put together to see how we can identify opportunities emerging out of the present context. Hearty congratulations. I'm very
happy that you have identified very diligently the areas of potential cooperation, which is devices, home care, healthcare, education. They're all full of prospect. And also the enabling backdrop of environment is very conducive, very opportunistic. Philippines and India share traditionally excellent friendly ties, and the time has come now to translate that general goodwill, warmth, cordiality, and friendship into tangible benefit for peoples from both the sides. This is a wonderful opportunity, and we'll be very happy at the Government of India, Ministry of External Affairs, to facilitate, to assist, to encourage and promote this process. And as life returns to normalcy post-COVID, we have to be prepared for emerging opportunities on the horizon. And you have industry leaders from both the sides, whether it is healthcare, whether it is devices, and also all the related allied areas. It's my pleasant task to assure you of all the support from the Government of India at every stage of realizing the ideas that you have so thoughtfully, so diligently discussed. The devil is in the detail. We need to come to the specifics. We all know that we both speak English, we have friendly feeling, there is opportunity. But the task is to convert that into real tangible benefit. For example, I have heard experts say that the infant mortality rate, maternal mortality rate can be improved through collaboration. This would certainly be of interest. And here is where our competitive advantage. Perhaps you may source this from elsewhere, but the right match is India and the Philippines. So please avail the opportunity and be party to this exciting collaborative venture. And once again, I would like to heartily congratulate and assure that Government of India, Ministry of External Affairs will be fully supportive to realize all the ideas. I would like to also recognize and welcome Mr. Jayesh Ranjan from the State Government of Telengana, who will follow. He has been actually leading great initiatives as Hyderabad and the state of Telangana is emerging on the global hub as a major center for healthcare and the related sectors. Thank you very much for giving me this opportunity. Wish you all the very best.
Thank you, Mr. Rajasekar, for your closing address. This time, I'd like to welcome on screen Mr. Jayesh Ranjan. He is a Principal Secretary of the Department of Industries and Commerce and Department of Information Technology, Electronics and Communications, Government of Telangana in India, for his closing address.
Greetings to all the fellow panelists, fellow speakers. Greetings to all the audience members, business groups from both India and Philippines. I'm delighted to be delivering the closing address in this very important business conference put together by the Indian Embassy in Philippines. I'm delighted that the conference has evoked so much of interest and so much of appreciation from all the participants. As I was introduced, I work for the government of Telangana, and I look after the portfolios of industries and information technology. I am also responsible for encouraging Indian companies to set up their manufacturing facilities, their service facilities abroad. So I find it to be very appropriate to be discussing this very important issue of medical cooperation between India and Philippines. So while in the earlier sessions, all of you must have got a very good understanding of the national scenario. The fact about India is that ours is a federal country. And while the national goals, national objectives are set up by the federal government, the national government, but eventually the states here receive lots of autonomy in implementing those programs. So states are free to design their own priorities, their own approach, of course, within the boundaries of the national framework. So as was mentioned, I represent the state of Telengana. This is the youngest state of the country. This was created in June 2014 as a separate state. And while many of you may not know of Telengana per se, but our capital city of Hyderabad, I'm sure will be known to most of you, since we are interacting with healthcare and medical and medtech professionals. Hyderabad is a very, very important, very prominent global center for pharmaceuticals, for biotechnology, vaccines, life sciences in general. So I would now, in the few minutes that I'll be interacting with you, I would now like to give a state's perspectives on how we approach the entire life sciences and healthcare dimension. So as I mentioned, ours was the newest state in the country, which came into being in 2014. And after we became a new state, we developed a policy, a industrial policy and investment policy, which is called TS-IPAS. In 2014, when we became a new state, coincidentally, our new Prime Minister at that time, Mr. Narendra Modi, he launched a national flagship program, which is called Make in India. And I'm sure many of you would have heard about Make in India. But after he launched this program, he also encouraged the states to carry out reforms, because he himself was the premier of a state for many, many years. And he knew that Make in India kind of a flagship program will not move ahead if the states don't cooperate and participate. And he encouraged the states to carry out reforms. And I'm very happy to share with you that the state which did the maximum amount of reforms is the state of Telangana. I told you about the TS-IPAS. That is the name that we use for our industrial policy. It has some amazing path-breaking features, which makes doing business in Telangana very, very easy. We have reduced times which are required for giving approvals and permissions, etc., literally to a matter of 1 week or 10 days or so. We are the only state in the country which allows industries to start the construction of their civil works, the factory buildings, etc., without the necessity of any approval or permission. Even in the most advanced state in the country, it typically takes a couple of months to get all the paperwork cleared. In Telangana, those 1 month or 2 months, we have made it 0. So you take the land from the government in the morning, and you can start the construction of your factory the same evening. So that is how easy it is to do business here. Life sciences is one of the priority sectors for us. In fact, there are 14 priority sectors, but the life sciences industry goes, the legacy of this industry goes very deep in our state. In fact, you heard some of the speakers earlier who spoke about healthcare, who spoke about life sciences, who spoke about medical technologies. In all these spheres, we have a very rich legacy. In fact, the first state-led public enterprise for life sciences actually started in India, in Hyderabad, a company called IDPL, Indian Drug and Pharmaceuticals Limited. And many people who used to work with this company or who were connected with this company, they eventually became entrepreneurs. In fact, a while ago, you listened to Mr. Satish Reddy, who represents Dr. Reddy's lab. In fact, this company was founded by his father, late Mr. Anji Reddy, who incidentally used to work for IDPL, but he chose to become an entrepreneur himself. and he has now created this global company called Dr. Reddy's Laboratory. So there are many such examples in Hyderabad, and today Hyderabad accounts for more than 40% of country's pharmaceuticals production. Of late, particularly in the last 2 decades or so, we decided to focus our attention on biotechnology also. And I mean, it's a nice coincidence that we are having this conference, as we are all globally, we are tackling this dreaded COVID pandemic. And again, I feel very proud to share with you that 2 of the 3 vaccines which are being administered in India today actually are manufactured in Hyderabad. They are developed in Hyderabad. They are manufactured by Hyderabad-based companies. And I feel very proud to share with you that 30% of the world's vaccines are manufactured in Hyderabad, including the most relevant COVID vaccines. So this is the prowess that we have developed in the areas of vaccine R&D, vaccine manufacturing. We have also become a very important destination where lots of digital health related work takes place. Many companies who now have chosen to do their R&D using technology, not just in the labs, are preferring to come to Hyderabad. 2 recent examples are Novartis and Medtronic. As all of you would know, these are 2 of the biggest companies of the world, and in preference over all other Indian cities, they chose to come to Hyderabad to set up their digital R&D centers. We have also become a very important destination for medical devices. In fact, we were one of the first states to set up a dedicated industrial park for medical devices. And I again feel very proud to share with you that close to 50 companies have chosen to establish their manufacturing facilities in our medical devices park, which includes some very, very eminent names. In fact, there's a domestic company called SMT, which is setting up Asia's largest stent manufacturing facility in our park. And in a matter of couple of months, their facility will be inaugurated and it will be in production. So the point which I'm trying to make is that Telangana offers the best ecosystem for pharmaceuticals, for biotechnology, for R&D, for manufacturing, and also for medical devices. And this ecosystem has evolved over almost 5 decades. So you can imagine how deep the roots of this ecosystem are and how comprehensive this ecosystem has become. So any new company which wants to set up its facilities in Hyderabad, they get a very advanced advantage of plugging into this ecosystem very, very seamlessly. The government is also very keen to upgrade our infrastructure, become much more world standard, comparable to global standards, the best global standards. So I would like to name a couple of important initiatives that we are embarking upon, and companies from Philippines who are participating, who have now developed some interest in India. I'm sure this opportunity will be this opportunity will be really godsend for them. So in Hyderabad, very close to the city, actually literally on the outskirts, 20 kilometers from our international airport, we are in the process of setting up world's largest pharmaceuticals park, which is called Hyderabad Pharma City. This is set up over 20,000 acres of land and state-of-the-art facilities, including the government taking responsibility for the entire effluent treatment process. This, as many of you would know, who are in the business of manufacturing, that environmental issues are very prominent in the manufacturing process, and many clusters have not been able to evolve, or they have faced challenges due to issues related to environment, pollution, effluents, etc. So in Hyderabad Pharma City, the government itself is taking responsibility to provide state-of-the-art facility. So this is one infrastructure, one industrial park that everyone is really looking forward to. And I would encourage pharma companies also based in Philippines to look at it. I already told you about the medical devices park, which is spread over 250 acres. And it is literally almost full. But now, looking at the interest and demand, we are expanding it by another 250 acres so that more companies can be accommodated in the medical devices. The biotechnology work, the vaccines manufacturing, etc., again takes place in a very unique purpose-built industrial park, which is called Genome Valley. And the who's who of the world actually operate out of Genome Valley. But we are again in the process of setting up what we call as Genome Valley 2.0, which will have much more modern facilities, including ready to move and plug and play space. So good quality infrastructure with talent, with supportive government policies are available in the state of Telangana. I already mentioned that we have ensured that the ease of doing business in our state is comparable to the best in the world. And through this seminar, I would urge upon companies based in Philippines to look at opportunities of setting up their units in India and giving preference to the state of Telangana and the city of Hyderabad per se. So I'm happy that the embassy has taken this initiative to connect us, and I would request you to please let me know over mail or with the help of the embassy if you require any further guidance or clarification about anything that we have said. But as I said, I'll be very happy to welcome you and encourage you to look at India and towards Telangana in particular. Thank you very much for giving me this opportunity. Have a great day ahead.
That Mr. Ranjan, and now we would like to call on Mr. Nishikant Singh, First Secretary for Economic and Commerce at the Embassy of India, Manila, to share his vote of thanks.
Thanks. Yeah, good afternoon. I hope I am audible.
Yeah.
Yeah, so good afternoon, Excellencies, distinguished panelists, and participants. I extend my heartfelt gratitude to all of you who spare their valuable time to attend this event here. So this event was made possible today with the great support we had from our partner organization, Business World, Federation of Indian Chambers of Commerce and Industry, Engineering Export Promotion Council of India, IBF, FICCI Philippines, and Management Association of Philippines. We look forward for our endeavor as missions endeavor to organize more such sector-specific B2B engagements across the emerging tech space and other sectors. So as we build together on our people-driven partnership. So thanks everyone for attending this conference today. Mabuhay and namaste.
And with that, we have reached the end of our program for today. Again, thank you very much to all of our speakers and delegates. The India-Philippine Business Conference on Healthcare and Medical Cooperation is presented by the Embassy of India, Manila, and Business World Publishing Corporation with partner organizations, Federation of Indian Chambers of Commerce and Industry, the India Business Forum, EEPC India, Federation of Indian Chambers of Commerce, and a Management Association of the Philippines, and of course our media partner, the Philippine Star. Now we would also like to invite everyone to the Hybrid Business World Economic Forum Special Edition with the theme Revolutions 2022, Navigating the Changed World. That's going to happen on May 24 to 25, 2022. Please visit www.bworldonline.com and follow Business World on Facebook, Twitter, and LinkedIn for more updates. This has been Jess De Los Santos of One News on behalf of Business World and the Embassy of India in Manila. Thank you and good afternoon.
For over 50 years, BPL Medical Technologies has been providing quality solutions in healthcare. We are made in India for India and the world. Our ISO certified production units And our widespread network of sales and service partners helps in maintaining smooth operations for all customers. We are committed to delivering excellence and driving innovation. BPL Medical Technologies offers a wide range of medical solutions: cardiology, critical care and surgery, imaging, women and child health, home care, consumables and accessories. BPL Medical Technologies offers end-to-end solutions for hospitals and medical facilities, including ambulatory and emergency, operating rooms, ICU and NICU, radiology, general wards, OPD, and pharmacy. We've been fortunate to work with some of the biggest names in the healthcare industry and are thankful for their kind words. We are always close to you, providing end-to-end solutions that meet all your needs at the right time. We look forward to being your medical solutions provider and building a long and fruitful partnership.
Healthcare is a basic human right. Yet sadly, this remains out of reach to most Filipinos, especially those in greatest need. The COVID-19 pandemic magnified and amplified the problems of Philippine healthcare. But imagine a world where quality healthcare is affordable and accessible to all. This is the vision of AC Health. AC Health is developing an integrated ecosystem composed of service touchpoints across the health continuum. Integrated through and powered by human resource development, supply chain management, and technology innovation. Healthway operates as a comprehensive network of primary, multi-specialty, and corporate clinics that serve patients where they live and work. Generica supplies affordable medicines to over 800 communities nationwide. IE Medica and MedEthics ensure cost-efficient distribution of a wide pharma cabinet. Health Now is the country's first unified digital health portfolio, enabling a growing number of online engagements, including physician consultations and medicine deliveries. We are also building the Philippines' first dedicated cancer specialty hospital focused on providing affordable, high-quality cancer care to more Filipinos. QualiMed completes the AC Health ecosystem, enlarging our clinic footprint and providing a tertiary care hospital base, all to deliver truly integrated, seamless, quality, and affordable patient care for Filipinos. The health crisis confirmed our ecosystem paradigm. Shared vision, mission, and values ground us. Innovation, synergy, and scale position us for growth and leadership. Truly, the whole will be greater than the sum of the pieces. Together, in partnership, we will realize our collective vision for health and deliver on our promise to improve healthcare for all.
Made in India and marketed across the world. That's the mantra of global automotive giants today. The forging industry has played an equally vital role in boosting India's engineering capability. India has become a single-source total solutions provider in every aspect of forging, taking the lead in industrial castings too. India is now one of the top 5 in terms of global production. Reacting quickly to the needs of international engineering standards, Indian machine tool manufacturers upgraded their traditional manufacturing base to offer the latest. And all this is based on the strength of the Indian steel industry. Recognized as one of the very few in the world that's slated for major growth, India is now a significant exporter of prime steel. India's industrial performance has also been powered by a flourishing electrical industry in generation, transmission, and utilities. That's what has qualified India to become a project partner of choice globally. India is where the action is, because India is engineering the future, where you get the best of an established, mature industrial base and all the benefits of a robust, resourceful, fast-growing family of small and medium-scale enterprises. Send your shopping list to EEPC and see how your profits are made in India.
India, a country with 1.3 billion people, 4,000 cities and towns, over 6 lakh villages, have most doctors living in the cities. This leaves a huge population living in smaller towns and villages without access to quality health care. With the country within the grip of a pandemic, doctors and paramedics, even while working round the clock, could not meet the needs of the huge populace affected by the outbreak. Healthcare had to be taken to each and every home. But how? The answer was to transform access, experience, and outcome through technology. Harnessing the powerful combination of technology and human ingenuity, we provided innovative care that was patient-centric. People needed access to care that was convenient, equitable, and affordable when, where, and how they demanded it. Whether it's one-to-one, virtually, or at home. To support this, our Apollo 24/7 app with Doctor on Call, Medicine on Call, testing at home, all at a tap of a button became an instant hit. The step towards humanizing technology helped the clinicians to organize and coordinate virtual consultations and remote monitoring of patients involving the family members and caregivers. We launched Coverage, the blueprint to fight COVID, an integrated multidisciplinary COVID care management program that was rolled out to drive awareness, assistance, and screening, along with robust treatment protocols, all by leveraging technology to provide safer person-centric experiences. Our AI-enabled COVID risk assessment tool helped over 1.4 million people across 51 countries. In anticipation of an increased need of medically supervised isolated care, Apollo launched Project Stay I, an innovative initiative to strengthen the bulwark against COVID-19 by creating isolation rooms in partnership with hotels to provide medical supervision for quarantine, freeing up the hospital beds for more critical patients. Every experience was personalized and differentiated with the launch of AI-driven health management program called Apollo Pro Health, built on the cornerstone to predict, prevent, and overcome the non-communicable diseases for helping individuals take charge of their health. Better outcomes were delivered using advanced diagnostics and precision care technologies like robotics and minimal invasive procedure, ensuring shorter hospital stays and superior outcomes. This further eased out resources so that we could care for more patients. Humanizing technology for the clinical staff was interesting in its own way. Our clinical dashboard helped clinicians work smarter and communicate better. Picture archiving and communication system helped our doctors to conduct a more accurate diagnosis with chronological view of their patient's medical history. Apollo e-Access, the modern and sophisticated critical care monitoring system for anytime, anywhere care, helped us reach out to the remotest places, providing quality critical care services round the clock. Similarly, teleradiology helped faster diagnostics, provided improved and affordable consultation for patients in rural areas, with expert physicians and radiologists sitting miles away. Humanizing technology means bringing the human connection back into the core of healthcare. In the midst of the pandemic, we at Apollo Hospitals ensure that millions of lives are improved across the country so that the land of festivals, culture and heritage continue to remain a healthy place.
What makes a future special? Perhaps it's in what you see. And how we see it. What you hear. And how we listen. And if you seek a future that's worth depending on, we've got you covered in every way. We even added a little cup of comfort. And tasteful little details to show how much you mean to us. We are moving forward. Innovating our touch of care. Making us available at any hour, at any day. So we can be more responsive. So we can be more connected. This is how we make the future of healthcare special. By making you experience you are special in every sense. We go beyond care. Experience MaxiCare primary care centers today. MaxiCare Primary Care Center, a relaxing healthcare experience. Visit MaxiCare Primary Care Centers at these locations. or visit our website at www.maxicare.com.ph to check the branch nearest you. Maxicare, live your best life.